slept very well. But if the night is so long, you did something. Okay. Okay, as Chabi said, this is have I am looking for someone because the Basil. Yeah, okay. No. Someone kidnapped Basil yesterday. I don't know who, but yeah, we are happy to welcome home. Eh? He's my neighbor, so no problem. So probably we will start with Tanzania, my lovely. Because if you go in, you will see one book, K. I. He just married a Tanzanian woman, a beautiful one. So this is the reason I call Tanzania.
Hello. Hello.
Shabi, what happened? Ah, okay. No. Take your time. Don't worry. No signal. Okay. Okay, we start with Tanzania. Focal person represented by Basiliana from National Institute of Medical Research. You have 15 minutes, is it? 15 minutes? Uh, okay, 15 minutes. But don't worry, you can start over time.
Okay, thank you. I will present the update from Tanzania, and this will be on the Aedes surveillance gaps in Tanzania, evidence synthesis, community perspective, and the policy action. So we all know that vector-borne diseases account for over 17% of all infectious disease, and this causes many deaths and cases annually. And most of the prevalent diseases are transmitted by mosquitoes. Dengue alone, dengue fever has impacted around 390 million million people globally each year. In 2020 million cases, and around 5,000 deaths have been reported. Diseases have issues in the or affected regions because they pose health problems, and also they strain the health care system and hinder the socio-economic development. Despite this burden, Aedes surveillance has not been taken seriously and integrated in the existing entomological surveillance system. And this is the case of my country, Tanzania. Again, despite the fact that the WHO Global Vector Control Strategy and the National Vector Control Strategy have put more emphasis on community engagement and community mobilization with regard to vector control, this has again taken seriously, less utilized, and this is coupled by the issue of lack of skilled personnel from different levels up to the community levels to help with the vector control activities. So in this country update, I conducted 3 main activities. The first thing, I searched for published paper in 1 year, 2024-2025. I searched in PubMed and in Google Scholar regarding studies which were conducted were published in that particular time with regard to Aedes study in Tanzania. And from this, I highlighted key findings. Another thing I did is to do a cross-sectional study. This was about looking for community perspective with regarding to establishing and sustaining women-led vector around the lake zone of Tanzania. The third activity I conducted was to write a policy brief to call for action to integrate the Aedes surveillance into the national malaria national entomological surveillance system, which is existing in Tanzania, but it mainly focuses on malaria vectors. So this policy brief called for action to integrate this surveillance. So the findings with regard to the review of the recent published articles, I managed to get some, but here I will present 4 of them. The first one, this was published in 2024. It's about dengue virus transmission during non-outbreak period in Dar es Salaam, Tanzania. This was a cross-sectional study. The study has revealed that 17% of patients tested positive for dengue antigen during the non-outbreak period. Again, the 3.3% of mosquito pools were also dengue positive by RT-PCR. No human sample tested positive by RT-PCR, indicating low level or past infection. The higher infection were associated with this particular age, and for this case was between 20 to 40 years of age, and they reside in specific wards in the city of Dar es Salaam. This paper recommended routine surveillance or routine dengue testing and mosquito surveillance year-round. And the second paper was about the risk of Aedes-Borne disease in Tanzania and around the Tanzania seaport of Tanga, despite the community member being more concerned about malaria. The key findings from this one is that majority of the breeding sites, around 60%, were positive for Aedes larvae, and mostly around the port area in Tanga. Again, the Aedes aegypti mosquitoes were the most abundant near the port area than the surrounding resistance, insecticide resistance, and they were resistant to permethrin, but they were also susceptible to bendiocarb and DDT. The study also we are more knowledgeable about malaria and less aware of dengue and chikungunya. The reports, again, the prevention efforts focus on malaria with limited protections against Aedes-Borne diseases. Another paper was about advances in surveillance and control method for Aedes-Borne disease and urban vectors. This is a conference report. This conference was conducted last year in August in Dar es Salaam. Some of us were there. The main theme focused on new tool and global collaboration for vector control. During this meeting, the key highlight was the current control method control efforts are insufficient to control dengue outbreak. During this conference, this conference report, it highlighted that emphasis was placed on community-based and innovative surveillance approaches. Again, there is this paper which assesses the knowledge gaps and social demographic disparity in dengue awareness among high-risk community in Tanzania. This was also a cross-sectional study. The study included around 482 participants, where about 76 of participants had of dengue, but only 23 knew it is spread or transmitted by Aedes mosquito. So you can see there is a knowledge gap there. Again, knowledge on breeding sites and biting frequencies was a bit moderate. Again, women showed lower knowledge of mosquito biting time compared to men. And then this paper also revealed awareness of symptoms and prevention method was fairly good among the interviewed participants. This study called for targeted education to address knowledge gap and disparity in high-risky community. With regard to the second activity about the community perspective on establishing and sustaining women-led vector control groups, where I interviewed male, females, village leaders, and cultural leaders about this initiative. The findings were that the members of the communities accept this idea, and also they pointed out that they will support the establishing of these groups to cater for trainee of vector control in the community level. The males say that women trainer at the community would help to educate the people to keep their environment clean and use of the mosquito control method. The women revealed that they recognize the unique ability they have of passing information from one person to another, and also they recognize their effort to in mosquito control in their families. Again, for the village leaders, they recognize the importance of this group of women to take lead on vector control in their community. They promise to support by raising funds and create bylaws in non-compliance and also for the revenue collection to sustain this group of women. Again, the village leaders recognize women as a community-based learning point in vector control if this group will be established. They emphasize the preservations of cultural knowledge in their community. They also pointed out that this group of women will be the right source of information, particularly in the rural settings where there's no electricity. So the media infrastructure such as television and radio are not available. So this group of women will cater for right source of information when it comes to mosquito vector control. During discussion with this group of people, they highlighted the expected challenges when this group is being established, and also they pointed up the possible solution, what could be done if this kind of challenges could emerge. With regard to the challenges, the community's perspectives were that there will be lack of common understanding about this initiative, lack of incentive to support these women while participating in vector control activity, limited time to engage themselves in other economic activities such as agriculture while participating in vector control activity, inadequate support and discouragement from their partners, resistance to change due to a traditional beliefs of viewing malaria as a common disease. So they say that they have been living with malaria for ages. So it's like they are used to it. So there is an issue of resistance to change. Again, the possible solution which were identified, including having community meetings so that everybody in that particular community will have a common understanding about this initiative, and therefore they will support the process. They suggested for community initiative for fund and potential income generating rather than depend on external support. They say that providing the women incentives, equipment for control, transport, salary, all kind of incentive will help to cater for some of the race challenges. And then advocate for collaboration with partners, husband, member of the family to support the initiative. Again, apply bylaws for non-compliance and also for revenue collection, which will help the women to get incentive to make sure that they participate fully in vector control activity. Again, engage local leaders in the process in order to address the more sensitive cultural differences so that vector control activity will move slowly. This community perspective study reflects a community-driven approach of using empowered group of women to cater for lack of skilled personnel at the community level. The community accept and support this idea, and they express they are willing to collaborate and contribute to the solution to have a more positive impact on community health. And this finding has been published in this paper. For more detail, you can download and read it. Again, for the policy brief, I developed a policy brief for advocating for integration of Aedes surveillance to the national malaria entomological surveillance. The integration of surveillance into this national entomological surveillance align very well with this year WAASuN theme, which says building resilience system to prevent and mitigate Aedes-Borne disease outbreak in Africa, and also It aligns well with the global and the national vector control strategy, as I have pointed earlier. So this policy brief has been submitted to the Minister of Health, and I believe they will take action because it is easier and it's cost-effective to integrate to the existing surveillance rather than starting from afresh. So with regard to the challenges of the overall country update, there's general lack of funding in capacity building and operational research with regard to dengue surveillance, and also there's weak community engagement when it's come to Aedes surveillance. Again, as I pointed out earlier, Aedes surveillance are not integrated in the routine national system. Therefore, with regard to recommendation, Tanzania need a proactive integrated approach to surveillance, and the findings also recommend the need for policies that support and sustaining women participation in controlling mosquitoes. So I wish to acknowledge the WAASuN for support me to attend this conference. I really much appreciate this support. And also my institute, the National Institute for Medical Research, for coordination and implementation of the community study. I wish also to acknowledge the WHO Mwele Marichela Mentorship Program, on which I'm a mentee, and the Pan-African Mosquito Control Association, particularly Women in Vector Control Excellence Award. These two mentorship has enabled me to get the stipend money to conduct the community study. So it was not funded. It's just my passion to use my own stipend just to document, just to get the baseline information. What will the community say if I will embark on establishing women-led vector control groups to cater for the lack of vector control personnel at the community level. Again, I wish to acknowledge the Women Lift Health, in which I'm a cohort member, and the community authority, the field assistant, and everybody who supported me to do the community activity, and also to to help me to get information on the country update with regarding. Thank you so much for your attention.
Thank you, Basiliana, for sharing this interesting study. And congratulations, you mentioned that you use your own resource to make this study. This is really, we have clap again for her, because yeah, thank you very much. Okay, maybe you can have a seat. We will continue with the DRC. After, maybe we will take a question. DRC? Shabik, maybe can you advise Guinea focal person to be online? I don't know if he's online. Yeah. Okay. DRC? Yeah. Okay, Prof, you have a floor. 10? 10 minutes. Okay. Thank you.
Merci beaucoup. C'est ce que nous faisons en RDC. Ce que nous faisons en RDC, nous sommes en train d'élaborer des stratégies pour évaluer les outils des LIT et aussi l'engagement communautaire pour la lutte contre les arboviroses dans un contexte de changement climatique. Et vous savez, la RDC subit de plein fouet les désastres de changement climatique. Voilà.
Okay, maybe I know the slide is on English. In English, we maybe after Shabi, can you help maybe just to resume, or because if you want to translate phrase by phrase, we will maybe lost a time. Maybe you can catch. Oh,
Non, je ne parle pas anglais moi là.
Okay, anyway, go. We after we can just resume the content. Shabi can help. Yeah, yeah. You can go.
Yeah. Donc, vous savez, en RDC, il n'y a pas un progrès. Et donc, nous savons que les maladies, les arboviroses, fièvre jaune, dengue, chikungunya, sévit de façon endémique. Donc, c'est tout à fait normal pour nous. On ne parle plus des épidémies parce que nous vivons avec tous les jours. Tous les jours, les maladies là sont là. Et les vrais problèmes, les indices entomologiques sont très, très élevés dans tout le pays. Dans tous les pays. Et les études entomologiques que nous menons, c'est un peu, tu vois, c'est un peu disparate. Tu vois? Mais quand tu regardes par rapport à la carte épidémiologique, c'est tous les pays. C'est tous les pays. Mais la carte entomologique, tu vois, ça ne représente rien. Ça ne représente rien. Voilà. Oh là. Voilà. Et comme au pays, il n'y a pas un programme de contrôle contre le vecteur, et la RDC, c'est une zone à risque des arboviroses. Et les arboviroses circulent de façon endémique. Et donc, le nombre d'épidémies en RDC, on ne sait même plus les compter. On ne sait plus les compter. Donc, on a plusieurs épidémies des arboviroses. Et donc, l'engagement communautaire n'existe même pas. Et nous avons réfléchi si nous pouvons mettre en place avec le contexte de changement climatique un programme d'évaluation de méthodes d'élite et de stratégie. Et comme on a appris qu'ailleurs ça donne de très bons résultats, nous aussi, on voulait aussi mener ces études-là en RDC. Voilà ce que nous avons mis en place. Et nous avons des approches de différentes méthodes, des mass trapping avec des BG gates et la destruction des gîtes larvaires. Ah, ok. Et la destruction des gîtes larvaires. Et aussi, on a mis en place les pièges d'autodissémination, les intouchers. Les intouchers pour voir comment aider à réduire la densité larvaire. Et aussi, on a une zone, juste, on fait l'assainissement, donc la destruction de gîtes larvaires, et une zone contrôle. Une zone contrôle. Et parce que les pièges, quand vous prenez des mass trapping, ça coûte trop cher. Et nous, on s'est arrangé de les fabriquer localement, d'adapter et de fabriquer localement. Et ça donne de très bons résultats. Et dans cet engagement communautaire, on a pris les femmes enceintes, les femmes et les jeunes qui vont implémenter les mass trapping. Ce n'est pas nous, mais c'est la population qui s'implique pour faire ce travail-là. Et nous allons évaluer à tout moment avec le Procopac, les BG Sentinelles, ainsi que la surveillance des indices larvaires. Et nous faisons aussi la surveillance sérologique. La surveillance sérologique, nous prélevons le sang pour voir la circulation des antigènes en RDC. Et ça donne des résultats très intéressants, je vous assure. Très intéressants. Et tu vois, là, nous sommes à l'école. On a appris aux enfants comment identifier les gîtes et comment les détruire. Et là, c'est les femmes qui placent les BG gates. Les BG gates. Et chaque ménage, on lui confie 2 ou 3 BG gates qui va surveiller, indépendamment de nous. Donc c'est pour lui, c'est sa propriété. Et voilà, là c'est la sensibilisation des groupes de femmes qu'on a pris. Et regarde le résultat très intéressant des BG gates. Des BG gates. Ça c'est le papier collant plein d'Aedes. Plein d'Aedes. Voilà. Et quand on a évalué, on a remarqué que la densité des Aedes a sensiblement baissé. Et ça nous donne ça, la réduction des indices et même la densité des autres équilicidés et vraiment la proportion de femmes et de jeunes qui sont vraiment engagés dans cette activité-là. Ils trouvent vraiment intéressant. Donc, les grands problèmes que nous avons, l'étude est limitée à l'échelle. Donc, on ne peut pas aller dans un grand site pour des contraintes budgétaires. C'est une étude pilote. Et les souhaits pour nous est qu'on ait un peu trop de financement pour rendre cette étude à l'échelle. Et le contexte des changements climatiques qui perturbent le pays, c'est aussi un grand défi. Et donc, c'est ce que nous faisons. Et cette étude a bénéficié du financement de Science for Africa de Bill Gates. Et nous travaillons en collaboration avec l'IMT Anvers, qui est notre consultant, et WAASuN, qui est notre grande famille, qui nous soutient, qui nous a vraiment beaucoup félicité quand on a gagné ces projets. Vos félicitations là nous renforcent. Merci beaucoup.
Merci. Thank you very much, Prof, for a nice presentation. I think that I will give 3 minutes to Shabi to resume for English speaker. Just a key point. Yeah.
Okay. So fortunately, the slides were in English. And fortunately, we have rapporteur French and English. So we are so lucky. Fortunately, the chair is also French and English. So I think everything is already well done. So roughly what he's saying is like for the first slides, in terms of ENTO activities in DRC, is really scattered. So compared to AP activities where they try to cover all the country. So what you talk about ENTO activities is not really getting people in like AP activities. So that make their work a little bit difficult in terms of funding and how to get people involved in the activities that they are doing. So that's the first two slides. After that, what are the community engagements? How do they work with the people in the community? So they try to work with the women and the young within the community to make sure that whatever information they are coming in terms of vector control, these people can be involved in and actually acquire all the knowledge at the basic level to make sure that whatever they are bringing is something that people capture, and they can also support all research activity that they are doing, because when you go to the community, they rather like going to what people coming to take, their fingers. I remember my mother, when she goes to the hospital and you give her hands and drugs to drink, she said, no, they did not inject me. It means that I'm still sick. Those are the things that people in the community can have in their mind. So when you talk about ENTO, it's actually difficult to get people involved. So they try to involve the community by, go to where the women, the youth, to help them in what they are doing. Aside that, presented the data that they have from whatever activity they did, and overall, we have the same problem, lack of funding and lack of community engagement. Thank you so much, Prof. Yeah. The Prof or the Prof of the Prof.
Thank you very much, Shabi. We are now moved to the internet and web, because it's Guinea, yes, Guinea focal personnel is online. He will share with us the update from Guinea. Keita, I don't know if it can be online. High tech. We are trying to join. So, ok, coupe le micro. I think that another person. No, no, there is another country in line. No, I think that. Yeah. Sorry, Guinea is not online. So, yeah, now maybe we can move to the question. Please, the two presenter, Basiliana and Prof, I invite you for the question. Okay, so we have a time for plenty questions, so we can start. Shabi, okay, we can go. For this side, left side, Mike. Shabi, Mike. No, 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 not Basil first. After Basil, we take it.
So my question is for Basiliana. Did I say that correctly? From Tanzania. So I really enjoyed your presentation about the women-led vector control groups, and it was amazing to see or to hear that the community was supportive. Are there any plans to move forward with those groups? That's my question. Okay. Are there any plans to move forward with your women-led vector control groups?
Okay, should I continue responding?
We have a time, so we can respond.
Okay, thank you so much for a very great questions. Yes, the plans are there. I'm currently developing the proposal to prove that proof of concept, but the issues I'm lacking are the potential funders to fund this. Maybe if you have such, please support me.
Okay, next is Basil.
Yes, thank you. Good morning, all. One question for Prof. Metelo about just to know a bit about the study design. Also, during your presentation, you say that you use several traps for mosquito collection. All these traps have been used in the same location, or in the one location you use stick trap, and other location you iketsu trap. I would like also to know in which city have you implemented this study? Have this study covered all the city? How the neighborhood was were selected, or is this the neighborhood in the city? Also, how the household were selected to have a bit to make a comparison with the neighborhood that you implemented different trap. There is this, if there is another neighborhood that you use as proxy to see if your strategy working well as you.
Prof, is okay, or we can translate in. Okay. Shortly.
Bon, je vais commencer par la fin. La question c'est, est-ce que l'étude que tu es en train de mener en ce moment, c'est dans toute la ville ou c'est une partie de la ville? Et comment tu as sélectionné peut-être les quartiers dans lesquels tu travailles, aussi les ménages dans lesquels tu travailles? Est-ce qu'à côté de cela, il y a des quartiers également où tu n'as pas mis tous ces outils de lutte-là que tu utilises après pour faire la comparaison, pour voir réellement s'il y a l'effet d'utiliser ces outils-là qui permettent de réduire les densités de moustiques dans la localité? Et également, tu disais dans ta présentation que tu utilisais plusieurs types de pièges. Est-ce que tous ces pièges-là sont utilisés dans la même localité? Comment tu peux faire après pour savoir qu'un piège marche mieux que l'autre? C'est ça que je voulais savoir.
Okay, you have a mic. Le micro.
Merci beaucoup pour cette question très, très intéressante. En fait, avant de commencer cette étude, on a fait beaucoup d'études d'évaluation entomologique dans ces sites. Donc, c'est des sites que nous connaissons déjà les profils. Et surtout, les critères pour ces sites-là, c'était des épicentres de l'épidémie de chikungunya à Kinshasa. Donc, nous avons évalué l'épicentre dans les quartiers périphériques et voir aussi la situation au centre-ville. Et quand on a évalué, on a trouvé que la situation était vraiment dramatique. Des indices entomologiques étaient très élevés. Et on s'est dit, avec le contexte de changement climatique, où il y a des pluies diluviennes à tout moment, et continuer avec ces études-là, on ne saura pas résoudre les problèmes. Mais maintenant, on évalue les méthodes d'élite. On suppose qu'on est dans une situation qu'on considère normale, mais qui est déjà alarmant chez nous, pour évaluer ces outils-là et qu'on sache la valeur ajoutée de chaque outil. On a plusieurs bras. Il y a le bras où on a seulement les BG gates. Et les BG gates là, c'est utilisé par les experts. On a les bras des BG gates utilisés par la population. Nous avons aussi un bras des into-care. Bon, into-care, c'est des pièges d'autodissémination et on ne pouvait pas laisser à la population. Mais nous utilisons un bras pour into-care. Et c'est ces différents bras que nous avons utilisés. On ne pouvait pas couvrir toute la ville parce que, je l'ai dit, contraintes budgétaires, et puis c'est une étude pilote. C'est une étude pilote parce que comme il n'y a pas un programme, nous sommes en train de réfléchir pour mettre en place un programme de contrôle contre les Aedes vecteurs d'arbovirose. Donc, c'est comme ça le design de cette étude. D'ailleurs, au moins, on a 2 financements là-bas. Bon, ici, j'ai présenté comme un seul financement, mais en réalité, c'est 2 financements avec des bailleurs différents. Donc là, il y a Bill Gates qui utilise l'engagement communautaire et il y a les grands projets qui utilisent les into-care et les assainissements. Donc c'est un peu comme ça.
Maybe I will just to resume. The question of Basil is relative to the experimental design. Basil was asking how the design look like, and the process that we have. The design set up 3 arms. One arms where they put the mass trap using expert people who are already trained to put the trap. The second arm is the arm where the community put the trap without any expert on that. And the third one is what we call into-care. Into-care where I think that is not a community, is a community. Okay, it's another trap, it's not a BG mass trap. So this is the 3 arms we use and we compare the result on the different situation. And he mentions that also this study is just a pilot because the lack of enough found. We're just in the locality where it is a hotspot of is a arbovirus, is a dengue? Okay, hotspot of dengue. So they plan now to move forward by maybe implementing in more area, but they still need some resource to do that. This is roughly what he said. Okay, another question. Where? Niger. Ah, yes.
Good morning, everyone. But I will ask my question in French. Thank you. Ok. À vous écouter, en fait, on a l'impression que vous avez les deux exposés qui sont passés. En fait, c'est comme si vous avez impliqué la population. Ce qui m'intéresserait ici, c'est de savoir comment vous avez procédé pour avoir la confiance de la population et la faire impliquer dans ce travail. Parce que finalement, on se rend compte que vous n'avez même plus besoin de main-d'œuvre. C'est eux-mêmes qui s'en occupent. Et la deuxième question, c'est de savoir les pièges, les 2 pièges que vous avez utilisés. Bon, il y a d'autres pièges, mais les 2, le Into-Care et le BG-Gate. J'aimerais avoir une idée sur les principes de fonctionnement de ces BG et voir aussi peut-être à notre niveau si on peut les trouver et peut-être les ramener aussi les modifier et pouvoir travailler avec à notre niveau, quoi. Merci.
Ok. Country Niger. You involve the community. How you proceed really to involve successfully the community? What is your procedure? What is your second question is you use two interesting trap, Intercare and Gate trap. How the trap work?
Merci beaucoup, ma sœur. C'est ça, non? Yeah, OK. My sister. Yeah. Donc, c'est pas facile. C'est pas facile pour adhérer une population. Il faut vraiment de stratégie. Il faut de stratégie. Et pour ce faire, on a utilisé les groupes leaders, les groupes de femmes leaders, donc qui travaillent déjà dans des ONG, dans des groupes de femmes. Nous sommes appuyés sur eux et on était obligé d'engager un sociologue. Parce que c'est pratiquement impossible. Il faut entrer dans la bile de la population, lui faire comprendre le bien fondé de ce que nous sommes en train de faire et l'expliquer en termes faciles. Et on a fait des carnavals pour le sensibiliser. On a fait des sketchs pour expliquer aux femmes là c'est quoi, qu'est-ce que nous voulons faire. Donc, en tout cas, c'est vraiment un long processus pour le faire adhérer. Mais quand ils ont compris les biens fondés de ce travail, c'est eux qui nous appellent maintenant. Oui, c'est eux qui nous appellent. Et d'ailleurs, ils nous programment. Non, aujourd'hui, nous voulons travailler. Oui, c'est eux qui appellent. Nous voulons travailler, nous voulons faire ceci. Nous voulons faire ceci. Et c'est devenu très intéressant. Et surtout, les pièges Gate, c'est des pièges pondoirs. Hein, c'est juste des pièges pondoirs, mais collants. Donc, le papier collant que nous mettons à l'intérieur, qui vient avec, donc nous achetons les papiers collants et les pièges Gate qu'on met à l'intérieur et après chaque 2 semaines, on vient, on tire les papiers là pour remplacer un nouveau papier. Et déjà, quand on tire avec eux, on voit comment c'est plein d'Aedes, ils sont vraiment très intéressés. Ils sont très intéressés et ça les motive. Et d'ailleurs, les pièges Gate, nous les fabriquons nous-mêmes. On a acheté une partie parce que ça coûte énormément. L'achat ne pose pas problème. Donc, on a acheté 100 pièges à 4 500 $, 100 pièges. Mais le vrai problème, comment les prendre, parce que c'est fabriqué par Biogen en Allemagne. Donc, comment quitter l'Allemagne et la RDC, c'est un pays où la douane coûte x10 du prix d'achat. Voilà. C'est là vraiment le vrai problème que nous avons eu. Et on était obligé de se rabattre au pouvoir de l'institution parce que l'avantage qu'on a, notre institution est un peu haut située et on obtient l'exonération. Donc, on obtient l'exonération et c'est ce qui nous a beaucoup aidé. Mais sans cette exonération-là, on ne pouvait pas acheter les pièges-là. Et on fabrique, mais les papiers, on est obligé de commander toujours chez Biogen, parce qu'on a tenté de fabriquer des papiers avec colle pour mettre. Quand vous mettez, ça ne respecte pas 2 semaines et puis tout est parti. Tu vois, dans nos contextes, il y a des pluies, il y a des ceci, les cols que nous mettons ne tient pas. Mais in tout cas, c'est difficile d'acheter parce que d'abord, c'est pour la première fois que ces pièges ont été fabriqués et envoyés à l'extérieur. Nous sommes la première institution à commander. Donc, ils n'acceptent pas même de vendre. Ils n'acceptent pas de vendre parce qu'il y a trop des autorisations. Trop des autorisations. Parce que les produits qu'on utilise là-bas, il y a des bactéries à l'intérieur, et des champignons, et puis aussi des pyriproxyphènes. Il y a beaucoup de produits et ces produits-là ne sont pas encore homologués. Ils n'acceptent pas eux-mêmes n'acceptent pas de vendre. Mais si nous ont vendu et nous ont amené, c'est suite à la position de notre institution et qu'on a donné des autorisations de la présidence et les pièces sont venues sans problème. Mais sinon, c'est encore difficile. Même eux-mêmes, les fabricants, ne vendent pas encore.
OK, thank you very much. Hein? On va...
Oui. Non, c'est ce que j'ai dit. Le 2 sont des pièges pondoirs modifiés. C'est des pièges pondoirs modifiés.
Okay.
Avec BG Gates, c'est des pièges pondoirs. Quand le moustique vient pondre, il se pose sur le papier pour pondre les œufs. Et s'il se pose, c'est un papier collant. Tu vois, il ne va plus partir. Même in tout cas, c'est la même chose. Mais la différence maintenant, in tout cas, c'est un piège d'autodissémination. Autodissémination. Dès qu'il se pose, il est contaminé par les produits. Et s'il part, il est infecté, même sa génération aussi est infectée. C'est comme de la charge des moustiques stériles. Voilà.
Okay, I will just roughly translate what he's saying. The question of my sister from AS is to know how the trap work and how they can push us the trap for Niger. Process that this is the one question. The another question is how they involve the community in this project, with pilot project. Process that you recognize that it's not easy to involve the community in this kind of study, but they use some strategies to really involve them. One of the strategies is to go through the leaders of women association, to talk with them, to explain with them the project, and usually they use the social scientists to help them to introduce them in the population and the community, and they make many activities, communication, sensitization. They explain them. They make some demonstration the trap to convince them that the trap is really efficient. And when we notice that after this information, this sensitization, many of the community accept really to use the trap, and some of them took the lead and plan the activity themselves to set up the trap in the community. So this is really a good, a nice experience for that. The second question, how the trap work? We have two traps. The BG gate. The BG gate is a OV position trap. It means that we collect gravid mosquitoes who want to lay eggs. In this trap, there is some kind of a sticky paper inside. If the gravid mosquitoes come and want to oviposit, they're stuck in the paper and they cannot escape against. Sometimes he says that sometimes when they remove the sticky trap in the community realize that there is a lot of mosquitoes. This also convinces people that the trap can work, and they are very happy really to contribute to this control project. Usually they remove a sticky trap each 2 weeks. Each 2 weeks. So they say that the trap can be made locally, but for the sticky paper, it's very difficult because they try to do it locally, but sometimes if the humidity destroy the sticky, and so that they order this paper from Biogen, which is a German company. He says that also, I think that they order 100 trap for the initial project. They order 100 trap. It cost 45,000 or c'est 4,500 euros. 4,500 euros. Okay, no, $4,500 means that one trap costs $45. The second trap called Into Care is not a oviposit trap, but is a oviposit trap or?
Non, c'est toujours oviposition.
Okay.
Mais là, on a ajouté les produits.
Okay. Ouais, je comprends maintenant. It's also an oviposit trap, but here the difference is there is no sticky paper inside. In place of sticky paper, you have a pyriproxyfen, you have some fungi and bacteria, and mosquitoes coming inside will be contaminated with the PPF, is a pyriproxyfen. When they fly away to another site, they can contaminate. It looks like it's the auto-dissemination of the product around the area. This is, but it's difficult. Now, at the moment, the company doesn't sell the trap. It just they produce a few quantity because they need some homologation. I'm not know if it's WHO homologation before they can really sell the trap. But for her, they got a permission from the government before we order this trap. I hope I translate.
Yeah, very good.
Okay, there is another question. Okay, I'm coming to you. Let my brother from Nigeria.
Okay. Good morning, everybody.
Morning.
Thank you very much, Prof. and Basiliana for the presentation. I was able to see that there is this intersection between your presentations, and it is something we always recommend, community involvement. And please, Malut, Basil, Prof, I think this is something we have to give some kind of robust discussion about. How we involve communities in our various countries. We all know what is happening to funding globally right now. I was listening where you talked about using your stipend to actually fund what you did, and now you are writing a proposal, hoping to get funding. And I was just thinking, almost thinking aloud, that assuming you don't get funding, and that's why I'm calling names so that we can discuss this thing, give it a more robust approach. Assuming you don't get funding, are there local sources? How do you actually get the project running without external funding? I'm asking these questions because for some of us, we want to really learn in this dimension. The funding is not coming. You have very good projects. You need the community to buy into it, but the community is used to always getting stipends because when they do anything, they get something, and they seem not to buying into some of these very good projects. Please, suggestions is for you, is for Prof, is for everybody. How do we make this work better in our various communities? Thank you very much.
Thank you very much. Sa question dit que entre vos deux présentations, il y a un point commun, c'est l'engagement communautaire qui est vraiment très très important pour la lutte donc, contre les arboviroses. Et son commentaire, il pose à tout le monde, professeur, à vous, à Manlou de Basile qui ont travaillé sur Aedes. Comment réellement, il faut qu'on discute. Il y a un bon, comment on appelle ça, brainstorming. Il faut discuter pour voir un peu quels sont vraiment, comment vraiment on peut engager la communauté dans ces structures de lutte. Et l'autre question, c'était beaucoup plus adressée à Basiliana, qui a utilisé ses propres ressources pour pouvoir faire l'étude, son étude. Et maintenant, elle est en train de rédiger un projet pour chercher des financements. Si au cas où elle ne trouve pas de financement, est-ce que localement, il y a des alternatives pour faire ça? S'il n'y a pas d'alternative, ça aussi, c'est un point qu'on peut discuter pour voir réellement comment il faut le faire. Parce que l'engagement communautaire nécessite des moyens. Si tu engages des communautés, il faut les trouver pour les désintéresser. Voilà. C'est un peu ça son commentaire. Si vous avez quelque chose à dire, tu as le micro. After Basiliana can also have a comment on what he said.
Bon, merci beaucoup. Bon, c'est que je conseille dans les activités sur des engagements communautaires, surtout dans nos institutions si pauvres. Parce que même moi, parfois, ça me fait rire quand je regarde tout ce qu'on nous donne comme notoriété, dire institution nationale, on dépend de la présidence, de ceci, mais en réalité, on ne verse même pas un franc sur nous. C'est pour la recherche. Mais ce que je conseille, il y a beaucoup d'appels d'offres et de financements. Il faut vraiment postuler pour gagner les grantes. Parce qu'avec les grantes, ça peut te permettre de mener des études et faire ce qui nécessite l'intervention de la communauté sans trop de tracasseries. Parce qu'il y a Welcome Trust qui lance beaucoup d'appels d'offres et qui donne aussi beaucoup de fonds par rapport à beaucoup d'études, voire même des renforcements des capacités des institutions. Il y a la fondation Bill Gates qui lance beaucoup d'appels d'offres et met aussi beaucoup de fonds. Mais je crois, ce que je vais solliciter à l'équipe de WAASuN, c'est de constituer une épine dorsale, donc la colonne vertébrale, de booster la recherche, la recherche, la recherche avec nos partenaires. Et on est déjà une force, voir autant de pays que nous sommes là. Et je crois qu'on peut aussi faire un projet qui englobe tous ces pays-là et on dispatche les fonds, c'est faisable, sous forme de consortium. Sous forme de consortium. Et déjà, ça va donner de très bons résultats. De très bons résultats. Et c'est un grand consortium d'ailleurs.
Okay. Well, I want to just resume what Professor said. He says that, yeah, it's true. It's difficult sometimes to get a fund, and he encouraged people to apply for different international call for funding. And he also says that sometimes even the government in locally put the institute at the high position, like some kind closer to the prime minister of the president sometime, but the government did not put money and give not money in for research. So they are also dependent from external funding. He proposed if WAASuN can maybe take a lead to see how we can build some kind of a consortium to work and or maybe go to collect or to get found outside to easily help different country to move forward with this community engagement in this vector control. Basiliana, your view about...
Okay. Thank you. Yeah, it is difficult when you write a proposal and it's not
Is working?
Okay, so it's not funded. So for this study, I even went further to discuss with the community. I'm talking about the community perspectives, to discuss what are the possible and a possible solution to cater for those challenges. One of the issue was fund sustaining these initiatives. So the community has pointed out, like having the bylaws at the community for revenue collection to sustaining this initiative. But this might face some difficulty. So after getting these challenges, before this paper published, I developed a policy brief and submitted to the Minister of Health through my institute. This was advocating for applying gender lens in vector control and having the community on the process, and that should not work like a project, but rather a program. So it will be integrated in the existing system, so that when these groups of women, this is community engagement, but the innovation here is that I streamlined to the women, and simply because the women, they carry the double burden of vector-borne diseases, because they are vulnerable to these mosquito-borne diseases. They are the caregivers in the families. When there's a sick member in the family, the one to leave the routine activities, the woman, to take your husband to the hospital, to take your children to the hospital. That's why I took this directly to the people who really suffer from this problem. So when it is integrated in the system, these people could be paid salary by the government. So by doing so, this one could be a sustainable way to incorporate to make this initiative viable. So, and also, at the beginning it's difficult because we need to prove this proof of concept in a project approach. And then from there, we will gather more evidence to convince now. Although I submit a policy brief, this is the only way scientists could communicate with the policy makers and decision makers. You have to come up with a piece of evidence so that they trust the process is working. What I've done is just is a baseline study, which I need really want to prove. So it's really a problem, and I appreciate your point that we need to have a general discussion, and because if you could call the yesterday's presentation, today's presentation, the issue of community engagement come more vividly, and if you also take into consideration those WHO document which has been advocating for community engagement and mobilization, if you take into consideration your malaria control program strategy and the vector control strategies, they're also advocating for this, but they are silently there in the document. When you come to the real world, they are not there. So we need to take action, yeah, and to save our continent, which we call it home. Thank you.
Yeah, thank you very much, Basiliana. We will maybe take two questions before that.
No, wait.
It's okay. Huh?
Oh, sorry.
What's that?
Yes, Lara. And then we have
the prof?
two questions. Responsive for? No.
Yeah.
A follow-up on what she's saying.
Yeah. Give a mic to the president, Dazi.
And so
after Dazi. After
I go
Dazi,
this
yeah.
way. Okay.
So thank you. I just wanted to make a point on funding and supporting some of the work that, and from what Odoka said. My view is that we, as a network, we are not really leveraging on the strength that we have. I'm saying that because these days, a lot of the funders try to look at proposals that look at mostly multi-country studies. In fact, we have focal persons in almost every country, and so it's to be very easy for us to collaborate across countries on some of these proposals. And so if you find a call and you think that it will involve other countries, I don't see why we cannot work together, develop those proposals. And I think we've done it before with Musa and other, members of WAASuN. So what I'm saying is that a lot of the proposals and ideas or calls that we see, let's approach each other. And even if you need a certificate to prove that, yes, you have a network, we have that. Some funders will want to see things like that. So we have all the subcommittees. I'm sure they'll be giving an update later this afternoon, so that these are some of the benefits I think we can get from belonging to a network like this. We have quite a strength that we can leverage on to be able to support each other and get funding. So that's what I wanted to say. Thank you.
Thank you, President.
Thank you.
You
No.
don't need translation, huh? Okay. Okay. We need two Ange and
before Ange, I think I want
no.
No,
There is
we are-
another. No. Derrière, il a
It's a
demandé.
question. For him, it's a question. So we are diving on this question that he was asking with different opinion. And after that, I go to him for the last one. My own opinion is on that also. That's what Prof said in terms of we have sub-community. So I think last year we also talked about how to improve, collaboration. That's where we created different subcommittee, funding committee, because Emery was talking about, okay, we are like a continent sitting here. So I think he talked about Wellcome Trust, he talked about Bill and Melinda Gates Foundation. So all these things that we can maybe see if there is any call that we can maybe, as a group, work to get maybe the funding. I think that's what exactly Prof is saying. And we have subcommittees for that. So after, I think we can come in and when the time for the subcommittee comes in.
Okay, no.
No, for
We
him
are
it's a
someone.
question. We are,
Huh?
He has a question.
You have a
Yes, this is a short comment
not a
about
question.
what Prof. Dazi said. In each country, we need to think about a small funding, what we call domestic funding. Otherwise, what is happening now with USAID will happen to everybody, and maybe we won't be here in 2 or 5 years. Imagine, in which country in Africa the government devotes 1% of its budget for research? I'm very surprised that my colleague from Tanzania used its own stipend for her research. Normally, this research will be very important for the district, which must be involving and support her. But unfortunately, there is no budget for research in our country. We always depend on USAID, Wellcome Trust, and so on. The day what Prof. Dazi said, write a proposal, and then we submitting a get fund. All the time thinking about that we get money from, this is not good, but let's think about a domestic funding also. Thank you.
Thank you very much for your opinion. I think that the two persons behind you, côté de Yaro là, deux des derniers. Ah, okay, Lara. Oh, sorry.
Okay, so hi. Yeah, congratulations and thank you for the important information for the two countries. I have some question and comment from Professor. The comment is about thinking always in by the things. So I think the system to function, the gate and the into care, is easy to reproduce with your own material and own thing. Only you need some time, of course, and you have to do some study comparative with the commercial and the other, because, for example, for us at the university, we begin to work with zero funding, and we create things because we have made almost all. And we have something similar about Ovitrap that people from Fiocruz lent for us. We say 3-in-1. It's only a box of plastic, and with some white stuff and BTI inside, we can take adult and different type of eggs. So I think you have to explore these two traps and try to begin to compare with other prototypes you can do, because seem like function good in RDC. That means it's not sustainable by always this big quantity of trap for all the countries. So perhaps that could be good, and perhaps we can try to do with other countries in WAASuN. For example, I'm interested in testing this type of trap, and we can think in write some project about this. So linking with this comment is, if you have do this comparative study between the two traps, the two OB traps you are using, if you have some comparative data, how is function better. And yeah, for the comment about funds, after the scientific subcommittee can speak a little about our ideas. My personal idea, and in the way of ANGS, is that sometimes we are thinking always international and research fund. But for example, what about this social fund? Because we did an interesting project in Cabo Verde with insecticide paint, and the money came from a social fund, because we transformed this social fund in social work and research. So sometimes we are always thinking in the same type of funds. Perhaps, for example, involve the what is this? Sorry, my English. Some industry of your country, for example, in Cabo Verde, CV Mobile and others, so local money that not always come from the government, to this type of social involvement, because for them it's good to give money for this type of projects. So perhaps we have to open our mind and thinking in other type of funding. Thank you.
Ok, tu voulais traduire? C'est bon? Ouais. Elle entend. C'est bon? Ou bien traduire? Ok, bon, si j'ai bien suivi et j'ai compris, elle demandait est-ce que vous avez fait, vous dites qu'il y a des pièges qui peuvent être faits localement. Est-ce que vous avez eu à comparer ce qui est local avec les trappes déjà commercialisées? Et si oui, est-ce que ça va, c'est performant? Et que pour un vaste pays comme la RDC, commander ces trappes doit revenir très cher, c'est sûr. Et il faut penser donc à vouloir faire aussi des choses localement, comme vous le dites, c'est très bien. Mais elle se dit que bon, c'est toujours bon de comparer avec le commercial, si ça a été fait ou pas. Bon, c'était sa question. Maintenant, son commentaire au niveau donc de l'engagement communautaire, je ne sais pas si Chabé a bien suivi, mais là, je n'ai pas trop bien compris là-bas. Mike.
C'est-à-dire que le social rentre dans la recherche. Donc, c'était juste des commentaires par rapport à
commentaire.
Ça. Comment communautaire et social en même temps, où on n'a pas besoin de payer quelqu'un pour faire un travail pour son propre bien.
Bon, c'est juste un commentaire. La question est de savoir si vous avez fait les comparaisons.
Donc, merci beaucoup, Lara. Les vrais problèmes, c'est des pièges d'oviposition. Donc, il n'y a rien de spécial dans ces pièges-là. C'est juste un bocal. Vous mettez de l'eau et vous le déposez dans la nature. Les moustiques viendront pondre. Voilà. Et il n'y a que ça. Il n'y a rien de spécial pour qu'on ne puisse pas fabriquer. Et les principes, c'est les mêmes. Le moustique ne voit pas. Le moustique ne voit pas, mais il est attiré par son oviposition. Dès qu'il sent qu'il y a un point d'eau, il va aller pour pondre ses œufs. Donc, il n'a même pas besoin de quoi que ce soit. C'est juste pour aller pondre. Et c'est ces principes-là. Donc, c'est comme même toi, tu prends un bocal, tu le déposes là-bas. Si c'est l'eau là, c'est l'eau de pluie ou bien l'eau de ruisseau, ils viendront pondre. Et ça,
mais est-ce que vous avez comparé?
Oui, nous avons comparé. Et parce que juste on a gardé le principe d'oviposition, mais les papiers, on n'a pas fabriqué les papiers suite aux difficultés qu'on a eues. Quand vous mettez les papiers, vous imprégnez les papiers localement. Après quelques temps, tout est parti. Tout est parti. Et on est arrivé à la conclusion, on change les dispositifs et les papiers, on commande. Et quand on a commandé les papiers, on a remis le papier là. En tout cas, il n'y a pas de différence entre les pièges de fabrication et les pièges de local là.
Okay, Lara, you understood? Okay, he's saying that they make a comparison between the homemade trap and the commercial one, and there is no difference. The only difference is the sticky paper. So until now, they don't success to make this sticky paper. They continue to order the paper, sticky paper.
Et puis pour l'engagement communautaire, aucun bailleur ne te donnera l'argent parce que tu veux faire impliquer la communauté. Ça, on ne donne pas de fonds. Mais quand tu utilises la communauté, il faut savoir manager. Manager parce qu'il est strictement interdit que tu payes à la communauté les services qui lui rend encore service. Donc
D'accord, c'est un commentaire. Bon, il nous reste 5 minutes pour la fin. Still, we have just 5 minutes to close, but we have to two questions. Okay. Okay, two.
Thank you very much for your both presentation.
Pardon, le micro. Parle dans le micro.
Thank you very much for your both presentation. But my question goes to the big boss.
Don't understand. Please, louder.
I had two questions, but Lara has asked one. In terms of figures, do you have some which can help us to understand the decrease of Aedes density? En français, est-ce que vous avez des chiffres qui nous permettent de comprendre la baisse de densité des Aedes?
Take a second question, and you can ask the second and the last. Okay, vas-y.
Okay, thank you for the different presentations. I have 3 questions for Congo.
Oh.
What are the objective target to use the different BG gates and Untuke? The second question, the different trap, does it trap online Aedes mosquito? Finally, BG gate, since it is kite, does it you lose some of the mosquitoes? I can translate in French.
Yeah.
Ok. Ok. Je disais que merci beaucoup pour les différentes présentations. Je dis que j'ai 3 questions pour le Congo. Ok. Pour la première question, quel est l'objectif cherché en utilisant les différents pièges? Quel est l'objectif cherché en fonction d'une étude bien précise? La deuxième question, ces pièges, ça attrape uniquement les moustiques, Aedes, ou bien il y a d'autres espèces aussi qui viennent se poser là-bas. La troisième question, pour une étude donnée, puisque comme vous avez dit en tant que c'est des pièges collants, vous ne perdez pas souvent une partie des moustiques. C'était les 3 questions que j'avais à poser.
You have.
Yeah, ok. Bon, au fait, avant de commencer cette étude, on a fait les baselines. Donc, on a étudié la densité du départ, et au fur et à mesure qu'on évolue, on fait aussi des évaluations pour comparer comment évolue la densité. Mais sincèrement, vraiment, il y a une baisse drastique. Mais la faiblesse est qu'on est dans une grande ville et vous choisissez une zone. Donc, il y a toujours risque de recontamination, de réinfection. C'est ça vraiment les grands biais. Mais sinon, en tout cas, il y a de très bons résultats. La baisse est sensible.
Est-ce que vous avez des chiffres? C'est ce qui demandait.
Oui, les chiffres, il y en a. Bon, je n'ai pas présenté. On évalue en termes d'indices.
Peut-être voilà. Après, si vous avez besoin de chiffres, vous pouvez les voir.
En tout cas, en termes d'indices, il y a une nette... Bon, au fait, l'objectif ici, on veut mettre au point un programme de lutte contre les Aedes vecteurs d'arbovirose. Et comme chez nous, nous avons des épidémies, bon, ça on ne peut même plus parler des épidémies endémiques. Donc nous sommes endémiques. Il y a à tout moment ces problèmes-là. D'où nous, on voulait, parce que Mais on voulait quand même des litres qui debout. Et à ce moment, on va généraliser, on va élaborer un programme pour la RDC. On sait que par exemple en RDC, si vous avez besoin de lutter contre les Aedes, vecteurs d'arbovirose, voilà la stratégie à utiliser. Donc l'objectif de notre étude, c'est celui-là. C'est celui-là. Bon, les Aedes simplement, bon, c'est des pièges à moustiques, non? C'est des pièges à moustiques, c'est des ovopositions, mais on sait que ces types de gîtes que nous mettons, c'est spécifique pour la Aedes, mais tu ne vas pas interdire les Kilex et les Anophèles de venir pondre, parce qu'on les trouve aussi. Voilà.
So, just saying that I think we had two questions. The first question is if it can quantify the reduction of larval indexes, because he says that after using the trap, the density of a mosquito drops down. So he says that he have some proportion, but unfortunately didn't put in the slide. So it may be the guy who asked the question can contact him at the break to know what is the percentage of reduction. So the second question is the gold. Why they use a different trap? Why one trap? He says that it is a pilot. You want to use several traps to select the best one before they go at the all the country. This is really the aims of this pilot study. So we have also a one question online. The last one, Shabi, can you maybe ask an online question?
Thank you. One question from Guinea. Moise Kabaduno, who was with us last year, is online. And he has one question for Prof. The question is about the attractant of the trap. Ça dit qu'il y avait la colle, un attractif. La colle dans le piège. L'attractif. Hein?
Non, il n'y a pas d'attractif, non. C'est les pièges d'oviposition.
Donc?
Oui, non. Il n'y a pas d'attractif. C'est juste un bocal. Juste un bocal qu'on couvre et on laisse un trou pour mettre les papiers collants. Donc il n'y a rien à l'intérieur.
Non. Adhésif, c'est ça? Oui. Ça parlait d'adhésif. Ça parlait d'adhésif.
Quoi?
No, there is a confusion. Let me clarify.
Yeah.
He says that there is no attractant in the trap. It's just a sticky paper.
Il n'a pas compris ça comme ça.
Okay, maybe Moise is online, so
Yeah,
maybe he's hearing us. So there is no attractant inside. It's just a sticky paper. The attractant could be maybe the water, because the water is as a source for mosquito to put eggs inside. This is the only parameter attracting mosquitoes to in the trap. There is no really attractant. It's clear?
Yeah, it's clear. Not
Okay.
for him. It should be clear for him.
Okay. So we are past 5 minutes on the time dedicated for this session. Please, we will close and go to a break. So I just resume. We had two presentations, and both highlight really the importance of the community engagement for vector control. So we also noticed the effort of each country to produce some data on arbovirus surveillance, while the lack of the funds. So I think that the reporter can come later with the complete report. I want really to clap a hand for presentators and also for people. Thank you very much. God bless. Shabi, you have a mic. I finished my job.
Thank you so much, Mr. Chair. And thanks again to the presenters. I think we are supposed to have like a 5 presentation during the time that the 2 people cover. So they represented the whole set of presenters. So I think we are lucky with a lot of questions for them and also some few clarification. And thanks also to the team for your contribution. That actually make it a little bit interesting. Thanks again. We are going for the break. So we have 30-minute break. And then we come to continue the session here. Thanks so much all. And then I hope you'll be here on time. Thank you. So it's at the same time, site here, just behind here for the break. try to actually firm up some of the ideas that we had to know how we move forward. And that's one of the questions that Emily was, I don't know, the comment Emily was giving this morning on how do we work together and how do we actually get funds together so that maybe whatever calls come out there, how do we work and how do we try to get a team that can maybe write a proposal, get funding. So in Senegal, we set up different committees. And one of the things that this committee actually fits in our overall monitoring and evaluation plan. So we normally owe results of all the committee to say, okay, because we had a plan in our monitoring and evaluation, like this year, that's what we are going to do. Next year, that's what we are going to do. So we normally have to do something and then report. That is part of the engagement that we also give ourselves in terms of the activity that we are doing. So I need to look for this list of committee that we have the list of the committee, but all the committee leads. We have the scientific committee, we have the communication and advocacy committee, we have the vector surveillance and control, monitoring and evaluation, and resource mobilization. Some of the committee, actually, we have some, I think during the past few months, we have some discussions. Dr. Joanna, I, and some of the group, we try to review some of the proposals that they sent to actually try to align with the overall M&E plan that we made. Still, as I said, we are all busy, but we decide to do something, we need to do it. So some were really reactive, some were really dormant for what she said yesterday. So I would like to encourage all of us to stop dorming. So to stop dorming and then be active, alive, and make sure that we grow as large as possible. Let people envy us. We are small, but I think we have big impact outside there. So let's continue that with our strength, and then we can get good results. The first one is the scientific committee, in which I'm part. My name should be somewhere there. Led by Prof. Lara. So that's the only presentation we have with the committee. But the other committee that they know themselves, they should get ready to come and give us their update events, oral or something. They should let us know what is there. So I'm going to look for all the chairs of the other committees to tag them. So first will be our chair for this session, and then over to you, chair of chair.
Thank you, Dr. Joseph. You've done much of the work that I'm supposed to have done, the introductory aspect. We have 20 minutes for your presentation. Thank you.
Thank you so much. Like I present here is the result of all the members of the group. So I hope my English is not a problem and can all the people understand, but feel free to stop me if I not speak so good. Okay, so that is all the group. So he's managed for Udoka and for me, and after we have different activities inside the group. So we have the majority of the people of the engaged to manage one of the group activity. For example, we have Basil. He is the lead of the scientific oversight and guidance group. We have Rebecca, responsible for the knowledge dissemination, Xavi for the collaboration and coordination group, Yewena for training and capacity, and we have to honor a member with us, Professor Sangari and Dr. Diallo. So what we do until now? So the first was just 1 year. So the last day of the WAASuN meeting in Dakar was proposed to create this scientific subcommittee of WAASuN. After we were working about our tour, our main document to begin, and in January, that is the data is bad, sorry, so in January of 25, we have the the first general meeting of the subcommittee, we are approved the tour of the subcommittee and we approved the activity plan. After approved internally, we sent for our chair, Professor Dasi, who approved at the end of the January the tour of and the activity plan of the subcommittee. And in our tour, we decided to meeting each 2 months. So the first meeting after this was in March. And in March, we have some activities proposal for the group. One that we are introducing in the first session was what about write the content of a proposal to looking for funding for WAASuN. So that is one of the things we are involved now. And Dr. Malou now in this meeting have a second version of this first proposal that we are working together in the scientific subcommittee group, and after we would like to share with all, and perhaps today we can discuss more about the things have to enter in this proposal. The other thing we decided was send a questionnaire to all the members of WAASuN, looking for what necessity the member of WAASuN have about training and improve the capacity. So in this meeting, we speak about these 2 things, and we have some work in advance. After we have the second general meeting in May, but was not possible to develop because we are not the quorum. So in our talk, we have some rules, and one of them is we need a quorum to have our general meeting. So we decided, because we are only 1 month before this meeting, the 5 WAASuN general meeting, have this scientific subcommittee meeting here. So what about our tour? So the main objective of this tour is to guide the purpose, scope, and structure of scientific research of WAASuN and the progress in the surveillance and control of Aedes mosquito in all the member states. About a specific objectives, so are the all main point of our net that we think are inside the 4 objectives. Support the local team in member state to conducting scientific research and reinforce the research quality of all the member and associated countries. Facilitate scientific collaborative among scientists in member state and external partners. Promote scientific production and dissemination of research findings in WAASuN and for the public in general, and provide scientific evidence that will impact policy changes and strategies in the fight against arbovirus disease. I think that is like the challenge, the last objective. Okay, so how about our activity plan? So the activity plan, we organize in 2 main objectives, like activities that are guides for these 2 responsible of each group that I told before. So for the first objective, about scientific oversight and guidance in our subcommittee, we put 2 main activities: review and standardize protocols for Aedes surveillance across member countries, review and develop data collection guidelines for WAASuN project. After we have a chronogram that I not put here for 5 years, so these activities we propose for 5 years and evaluate all this with the indicator that's present here. Okay, about the second objective of activities is the collaboration and coordination. And we have 3 main activities: search and share opportunities for collaborative research, facilitate the collaborative grant writing to answer finding calls, and review and approve WAASuN projects proposal. Our third objective of the activity plan is the part of training and capacity building. So here we propose 2 main activities: assess and document the training needs for WAASuN, that is do it, and I speak after this. Organize training programs and workshops for WAASuN group. And the last of 4 objectives of activities, knowledge and dissemination. We would like to organize webinar and symposium of interest for WAASuN community, publish research finding in high impact journal, and share data sets publicly when appropriate. Okay, so this is the activity plan, but what is the practice, what we are until now doing? So more or less are these 3 points that are put here, and after one that was a proposal for the last general virtual meeting. So the first is right, the WAASuN proposal for funding. I want to mark here that our committee is not responsible to look for the funding, but that is like create the content that is like the draft document that after the other committee that have to look for funding can use and adapt for the different situation. So in this proposal, we contemplate these 5 important points or main points. Like in the proposal, we have to speak about conduct training workshops for entomologists and health workers in WAASuN member states. Procure and distribute modern surveillance equipment, including mosquito trap, diagnostic kit, and GIS tool. We have speak a little about this in the other session, about why not the scientific committee thinking about new strategies, new tools. Other point is establish and centralize data sharing platform for vector and disease strength across West and Central Africa. Strengthen cross-border collaboration and risk mapping to enhance outbreak preparedness. And that is just in the other session we are speaking a lot about this. Develop and implement community engagement strategies for vector control awareness. So we have now the second draft. So after the first draft we discussed in March that Dr. Malou have more complete the draft, and we would like to send some more elaborate proposal, but we are in the way. The other of the activity we are stacking at the moment because the idea was for the committee that is the guidance, not the research guidance that is managed for Basil. The proposal was review all the standardized protocol that actually we have in the countries of WAASuN about Aedes surveillance in each country, put all together and standardize a new document. Actually, that is with the chair of WAASuN and the secretariat, because we ask for help to ask for all the focal points if they have some type of this document to send for us and begin with the work on review and standardize. The third activity that is the only we finished until now, and we would like to present the result now, the main result. We applicate the Aedes surveillance network training needs assessment questionnaire that all of you have to receive, and for all of you we obtain 40 answers we discuss now. And I introduce here other activity that was a proposal coming for the last WAASuN general meeting. Some people speak about why not the scientific subcommittee go further to create a roadmap of all arbovirus outbreak in the West African region. I put this here to discuss together. Okay, so that was I think I passed that, sorry. That was the result of the questionnaire. So the questionnaire was elaborated for the wellness. Have 14 questions grouped in these 5 topics, and was applied for all the members of WAASuN. I put the same vocabulary that was in the list, so we have active and dormant members that are 92 members, but the active members are 65. Only to thinking about what was the percentage of answer for all the community. So for this 40 responses, first we try to see the profile of the members. So the first question was about which category describes your current organization. And like you can see here, so the majority of the members are working in research and academy, And after we have in yellow and in violet, no, two other big pieces, like is people working in government and people working in research, academy, and government. The second question to see the profile of the group is how many years of experience do you have in Aedes-related work? And if you can see for the result of this answer, more or less 2/3 of the people are people with experience, more than 6 years working in the area. After we speak about how are the capacity all the members actually have, or what type of strategies, tools they are using. So the first question for this part is, which of these Aedes-related activities do you currently engage in? And the people can select all of the possibilities. So that means there is more than 40 results, because one person can, for example, select the 9 possibilities. But we can see some marks here, no? So for example, 32 of the respondents say that actually they are engaged in larval pupal survey and insecticide resistance and adult mosquito trapping. So that are like the majority, the activities more going forward for the group. But after we can see on observe, for example, for predictive modeling and GIS mapping, only 5 or 7 respondents say they are going with this type of activities. About what tools or techniques they are actually using, or they're using more frequently, again, we can see some difference between the categories. So the tool more used in this result was the VGS Sentinel trap, with 99 responses. And after we have, again, so things related with informatics system and statistic model, we have only like 3 answers, 5 answers, and for remote sensing, only 1 answer. Now, coming some question about the necessity. What are the things we need to improve and strong the WAASuN network? So what area do you need additional training? So almost in all, no? But we see some difference with insecticide resistant testing, that that was the category that have less answers, so that was the more strong capacity we can think in for this result. And after, for example, we have predictive modeling for outbreak forecasting with 27 answers, spatial mapping and GIS application 26, so that are necessity for our group to increase. Of course, they are all of them, but that is a reflex. Here we present different questions, so each category is a question. We use here the Likert scale. Between 1 and 5, people have to say what is the proficiency he has for this question and for this capacity. Sorry, because I think the graphic is cover part of the question. So if we see the part that is pale blue, that means the very low and low proficiency, so that means the necessity we have. And more dark is more proficiency, so high, very high. So we can see different about this. So we can see, for example, for predictive modeling, again, for outbreak forecasting, spatial mapping and GIS, risk assessment, and early warning system, more than the half of the line in pale blue. So that means are like weaknesses for the group. We can see all of the things we are speaking in these days. So for example, community engagement is down. And the rest. And we are more strong, or we are stronger in insecticide resistant testing and field surveillance techniques for the results, again, for this question. Okay, the last question was about what what format, what type of training the WAASuN community like more. So what training format do you prefer? So the more answer we receive in in-person workshop, hand-on field and laboratory training. How often would you be willing to participate in a training? So the majority of the respondents say twice time in the year. And about the barriers do you face in accessing the training? The majority speak about limited funding. So that was the result for the first questionnaire about training and necessities for the group. And that is all. Thank you.
Thank you, Lara, for that elaborate presentation and a well-done job. Ladies and gentlemen, the floor is open now for observations, input, and questions. Okay, Prof.
Give the scientific committee a very big clap. And sorry. I'm saying this because, you know, I myself sitting there and looking at and listening to them, also amazed at the amount of work that they've done within a very short time. And thank you, Lara, for your leadership. You know, because I know they've been meeting, I've seen emails, you know. And so I think it's a lesson for all the other committees. It's a challenge that we must all also wake up. And because this information is very relevant to us developing a roadmap for the network. So I just want for the resource and mobilization subcommittee, and I'm a member of that. You know, there's a saying that money doesn't like too much noise. So we are working underground also. So I'll report on that. Yes. So thank you, Lara. I just want to acknowledge the good work that you are doing and also encourage other committees to do same. Thank you very much.
Thank you, Prof. Observations, questions? Exactly. Comments. If there is none, Lara, thank you very much. Okay, we should still give room for that. Thank you very much. Please, a round of applause for.
Okay, thank you so much, Lara. I think, as I was saying, we have a list of the committee, and I highlighted the committees here. So maybe some are even forgotten on which committee they are, I'm sure. So I'm going to rate your committee, and then you look for someone to come and tell us what you have done so far or what you want to do. So I do it right now. The scientific committee, we have now the vector control committee. We had Toy, who is not around in. We have Dr. Malo, who was cross-cutting. We have Sylvania, maybe forgot. We have Prof. Kona Lucien. We have Dr. Emery, Prof. We have Dr. Basile. We have Festus, the chair, and I'm sure he forgot. And we have Musa. That is the vector control committee. So the name of the people that I listed, we can just take on, see what someone will come and tell us here right now. Okay, the other committee is communication and advocacy. We have Dr. Basiliana, we have Ange, we have Emelda. We went a lot, okay, and Crispin is not around, so I'm expecting either Ange or Emelda to tell us something. Yeah, you are in the committee. We have the resource and mobilization. The money doesn't have noise, but we want to know which what the music what is the music of the money. So the resource and mobilization. We have Dr. Bathiou, he's not around. We have Audrey, she's not around, but we have Prof. some ways around. So probably come and tell us the music that they are playing underground. We have the MNE committee. We have Dr. Mosha, Jacqueline. We have Shirley. We have Prof, who are also doing podcasting because of doing the budget and funding and, know how we are going to spend the money that he's looking for. So it's within the monitoring and evaluation committee. And we have also Eugenia, who was supposed to support them in that committee. So roughly, those are the committee and name of people. So I'm handing over to the chair to the second committee. Let's where we have the second one. Yeah, where we have Dr. Maulu, Prof. Kona, Sivania, Emery, Basil, Francis himself, and Musa. So I don't know, call someone else.
Thank you very much. I don't know, Dr. Musa, are you ready?
Please let us know, because I was expecting since he didn't bring it, so we are having only the scientific committee presentation, not knowing that they are hiding their things. So if the other committees have already prepared something, let me know and then I can correct it for presentation.
Until yesterday night, no, morning. This morning, yeah, this morning. So we woke up, huh? Is it? We are not dormants group. Okay. Open it. You can share the screen, double screen. Double screen.
Okay, you can start talking now.
Please, ladies and gentlemen, welcome Dr. Musa, representing Vector Surveillance and Control. Dr. Musa, let me just seize this opportunity to tell them that the work is still ongoing. We still work down to this morning. So what we have is what we want to present now. Thank you, Dr. Musa.
Okay, thank you very much. After the meeting of Dakar, after setting the subcommittee group, we, the chair exchange, wrote a draft of the TOR and sent to different members of the group. And each of us make a comment, amendment, suggestion, and it took all of the suggestion, reviewed of the TOR, and we have now a draft 1.0 we want to present you in 1.0. Want to present you and collect also your comment, your review, and your suggestion to improve the document. So, in terms of structure, we had we put a background where we define what is the purpose of to introduce what the meaning of vector surveillance and control subcommittee means, and the context this subcommittee was created, and state what is the content of the TOR of our committee. It means that how is composed, how is organized, what is the role and the responsibility of different members of this subcommittee. For the purpose, we say that the subcommittee must support, the purpose of this subcommittee is to support, coordinate efforts in effective vector surveillance, management, and control of Aedes mosquitoes across the country member of WAASuN. And the ultimate goal is really to reduce the incidence of vector arbovirus in different countries. Where the scope of the work, where really we will work, how we will work, we will plan to develop, the subcommittee will plan to develop and review all strategic documents like a guideline, action plans of vector control, and we can propose this as like a guidance to different members. We can use and adapt according to different contexts, because from country to another country, it should be a little difference. It should be better to have some kind of a guideline of vector surveillance and control, and each country can adapt it. Also, the country want to oversee all implementation of integrated vector management approach in different countries, just to gain some experience and maybe put together and share of this at a different member or in WAASuN, but also in outside WAASuN. If some other country need it, we can also provide this support. We need also to coordinate with relevant stakeholders like government agencies, NGOs, community group, to really ensure efficient program delivering. It means that if, for example, if the country we have some kind of vector control implementation, we can help to build really stakeholder engagement. You can help also, for example, to engage some government, NGO, and so. Each member in or person in the WAASuN member, country member, maybe can request these guidelines for that. We also mentioned that we need also to monitor and evaluate the effectiveness of the surveillance and also the intervention control in different countries to gain success, and also to have experience and also different gaps we need to fill. And also this subcommittee will have also the role to facilitate the collection, analysis, and dissemination of entomological, also epidemiological data. This is really some copious work. We also try to promote research and innovation in vector control and surveillance methodology. I was speaking yesterday. We want to introduce Wolbachia, for example, in Burkina Faso. The subcommittee can help to promote this kind of tool in the country's members, and also to provide recommendation to policymakers and public health authorities on control measures during the outbreak response. This is the scope of work we try to draft. For the composition of the committee, we hope that we can open the committee to each member of the country. We have different skills, including public health, vector control experts, entomologists, epidemiologists, and disease surveillance specialists, and other scientists working on arbovirus, even international health organization and community-based organization. We think that if we have this kind of member inside the committee, we can maybe be powerful to work. In terms of organization of the subcommittee, we propose a chairperson, and the role is to lead the subcommittee, organize a meeting, ensure effective coordination of different activities. We appoint an advisor, a technical advisor. We will be an expert to provide input in different vector control and surveillance. And also a member. We activity will participate in decision making, and also implementation of the action plan. We plan to have a meeting quaternarily, but we also can set up a meeting if there is a urgency or emergencies. There is also an ad hoc meeting we will plan when, for example, we are challenging to the outbreak or emergencies. And also during the meeting, different meeting, the minute of meeting will be recorded and shared to different members. During the deliverable is the annual working plan and progress reports, and also the guideline we will adapt or draft, or the protocol we will write during the year. This is the delivery for the year. And also we want to try to resume the different findings and recommendations regarding vector surveillance and vector control during the year. We try to draft a plan, a working plan, according to the objective. Is so long, I'm not sure I can go through that. But I just mentioned the different objective. I will just mention the different objective and maybe the timeline and indicators. So we have the objective 1 is to facilitate effective monitoring of vector population and distribution among member states. The role of the subcommittee is to draft a comprehensive strategy for vector population monitoring. The method we will use is a routine and systematic vector surveillance approach. And normally the plan is to start in January and March 2005. But it's not lack of fund. We are challenging to some problem of meeting. Maybe we can come later or that. The indicator is to improve an effective understanding of vector distribution across in country, but across also the different countries, WAASuN countries. The objective too is really to help to identify the vector breeding sets, but the idea is just to have some kind of dictionary for the breeding, the type of the breeding site, with how we call typology. For example, if you go to Burkina, we have someone called the breeding site overworld, and so for the our WAASuN member, it's better to have some kind of a dictionary, and we can help to define really the typology of the breeding sites. So, as usual, January, Mars. Number of habitat indicators, the number of habitat identified, characterized. A number of preference breeding sites identified across the country. The third objective is to track disease outbreak and trying to control and prevent the spread of Aedes-Borne disease. Here, the method is to draft also a comprehensive tool for surveillance of arbovirus disease outbreak in different. We will propose just a guideline, and the country member can update. So this is also the timeline. The time is off. A number of report case is the indicators, the spread and the affected population, and the number of vector and species positive for arbovirus. If we can maybe resume it across the West Africa or WAASuN member, it should be great. The fourth one is help to reduce the incidence of vector-borne disease in target area. One of the activities here is to draft also a comprehensive tool for prevention, and also to design and implement effective control, vector control measure, including larval control, adults, and surveillance. Have many methodologies to be used, and one of the deliverables is a monthly report on adults and immature vector control activities, and also a quarterly progress report on program objective, and also annual program evaluation. The five is to enhance community awareness and participation in vector control activities, and here we want also to draft something relative to community engagement and awareness activities. Could be the guide, and also try to share and also collect data from different countries to see, to measure the increased knowledge of disease transmission, and to see also if the density of vectors in different countries or target area is dropped. 6 is to foster collaboration and knowledge sharing among member states. We are already discussing of that this morning, but regarding the proposal. So a part of the proposal, we can also share the different information regarding surveillance and vector control, and share the experience between countries. And I think that this also, if we can feed the website with this kind of information, We will increase the platform usage and member contribution. And six, again, we will facilitate an effective monitoring of insecticide resistance to understand the spread of resistance. So we will also draft SOPs, standard operating procedure, to monitor the resistance in WAASuN country members. And also, we plan to draft insecticide resistance management strategic plan to be able to manage the resistance we observe across the different countries. The deliverable is a number of countries monitoring the resistance insecticide using the SOPs we will draft. And also the resistance profile of WAASuN country, if we can also use that to build the resistance map of across the vector. The last objective is to support advocacy and awareness. For that, we'll develop material for communication, material for a different message. This is a guide, and what I'm saying is just a guide. And the different member can exploit this material to adapt the message. So the deliverable increases awareness, policy engagement, and resource allocation. So this is the team. We are 8, is it? Yeah. This is what we did until now. So I let the comment to the president to finish our presentation.
Thank you very much, Dr. Musa. That was a smart delivery. Ladies and gentlemen, this is draft 1. We came up with this work around March 2025. Unfortunately, we couldn't meet the way we're supposed to meet. It was even an uphill task to be able to gather people together to come up with this document. So now we welcome input, observations, and comments. Thank you very much.
Thank you very much. Before I give the mic to Laura, I would like to say we clap for them, but just more, like this. Just more. If I go back to this document, the first time we received it is early January 2025, like 6 months ago. We eventually, Dr. Joanna and I, who were leading the review of all this paperwork, we tried to meet them, but we could not. So normally, what we share here is not the delivery. If you see your deliverable, it's not this. This is not your deliverable. This is the TOR, the activity timeline. And we have an MNE with deliverables. So what have you done? That's what I'm looking for. This was supposed to be signed by the chair. Like after you finish this, we discuss, we finish, we even send you a template to fit in this, which match with our MNE plan. So this revision had to be finalized, go to the chair to be approved, and then you implement the activities. Okay? So you are still at level 1. Yeah, so let me tell you. So don't clap for yourself because I need to emphasize that. This is not the work. So finally, we are in what? End of June. Make sure you finalize this by end of July so that the chair can sign for the second committee, because the scientific committee already have, I think Lara explained that already, that we made this approved by the chair so that we can implement the activities. So that is a trend that we are following. You have the sheets, this, I think we shared it to you guys so that you can put the activity in. I was expecting Musa to tell me, that, okay, in 2025, when I checked from maybe 19 to 2025, this is the number of outbreak that is happening now, because this is one of your deliverables. You were supposed to tell the members here how many outbreak happened last year to this year in our countries or in Africa or whatever it is. That is your deliverable. We agree, right? Okay, so go to your books, go to your notebooks and give us something. Thank you. Lara.
So, thank you so much. Result of the subcommittee. That is why we need the thought of all the subcommittees, because I see some things, some points that are the same that we point in the scientific. So the important thing now is after all the talk will be finished, have like a meeting together and integrate the function. So for example, I point like a develop strategies, guidelines, and that is one of the things we proposing. That doesn't mean that means it's good, but we have to integrate to not have like duplication of objectives and activities. For this, we need to all the subcommittee finish minimal with the thought, and we can after sit together. I point here to other, for example, promote research and innovation in vector surveillance and control tools. That is other thing that we propose to, and some partially things like we propose to like facilitate the dissemination of the data. So that is good. That is really good that we have this moment to discuss together and organize the subcommittee and integrate all in the best form. So thank you for coming with this information.
Thank you very much.
Thank you, Joseph. I think Lara has already mentioned or said what I wanted. The duplication, which I see, because I see a lot of things that the scientific committee wants to do, and I see the same things also in the vector control subcommittee. So I think we need to align the activities so that we don't have duplication. That's the point I wanted to make. And also to say that for a lot of the activities I develop, please align them with the M&E plan. So we have an M&E plan or strategic plan for WAASuN. So that should guide the activities that we want to do, so that we can report and see what the progress we are making, towards, the targets that we set ourselves for the network. So that's what guidance I want to give you. So if you don't have the M&E plan, we have it, I can share it with you, and make sure that the activities align so that we can measure progress next year. When we are reporting to our funders, we'll tell them we've done A, B, C, D. I hope you understand, yeah. So thank you.
Thank you, Prof. Any other comment? Thank you very much, ladies and gentlemen. I'm standing in for the committee. We will go back, sit and come up with a better document. Somebody is raising.
Yes, they did submit this to myself and Shabi, and we were tasked to just look at it and do exactly what Prof. Dazi is trying to remove overlaps and duplications. You had 7 objectives, but at the end of the day, we abridged it to about 4. And then we sent out a template that would clearly show your deliverables and the timelines that you had. I think we did share it back with you, but we're planning to have a meeting with anybody from that subcommittee so we can discuss and finalize it. but that meeting never happened. Exactly. So right now I'm going to send you an email with the, at least to Festus and Musa, and then you can share it with the rest of you. We want every subcommittee to have a template that we can all monitor. So I'm going to send that to you, and then you look through and see whether we've missed any of the objectives that you really want to do. It's been abridged to about 4, so that we can all work on it. We know we are all busy, so we don't want you to have 7 where you have to struggle to complete everything. So I'm going to share that with you, and then you can move on from there. But please, they beg.
Thank you very much.
Okay.
Which subcommittee is that?
Committee, I think we have advocacy now.
Communication and advocacy.
Yeah. Emelda, right? You are coming here.
So, gentlemen, please welcome communication and
Good afternoon to you all once again. I'm going to attempt to present what my subcommittee has done so far. But before I start, I'll issue a disclaimer and say that there are some repetitions in some of the activities, the activities, the deliverables, and the indicators. And as Joanna has said, and other people have also mentioned, we need to be able to streamline it so that we don't have different activities showing through different subcommittees. So please do not be taken aback when you see the repetitions of the activities. So I'm here on behalf of the Communication and Advocacy Subcommittee. So as mentioned in Lara's presentation, the whole idea to have subcommittees has been lingering for a while, and last year in Senegal, it was cemented. A few of us volunteered to join different subcommittees and were tasked with different activities or objectives. So the responsibility of our subcommittee was to improve communication strategies across the different member states. So the terms of reference that are outlined in this presentation include the objectives. It says roles and responsibilities, but not really. And then we'll show you the activities that we had outlined as our goals and some of the key indicators. Ideally, we should have timelines to share with you, but we've had a very big challenge as a committee with meetings. From the last time when I sat and had a conversation with Joanna on what we had presented, I think we've only had a few conversations and not an actual meeting. So we don't have timelines. What I will share with you are our objectives, the activities outlined, the deliverables, and then the indicators. So these are the team members who are so busy that we cannot meet. But we'll try and do better. The first objective of the subcommittee is to enhance internal communication. And by enhancing internal communication, I'm talking about the communication between us as member states. We plan to have, where you see D is the deliverables. So just before the deliverables are the activities, then you see deliverables, and then you see I for indicators. The activity to enhance, or the activities that we plan to do to enhance internal communication are to plan events, conduct webinars, disseminate reports, and newsletters. And the deliverables were to have biannual newsletters and network updates, to have an annual meeting report,
to advertise and facilitate webinars, to track, monitor, and share Aedes-related publications and collaborative projects authored and conducted by WAASuN members. Our indicators would be increased member engagement, feedback, submissions, and participation rates in internal events, and improved quality of feedback received in surveys. As I said, we haven't been operational as a subcommittee, so we don't have concrete evidence to show you that we've done this. However, for all of us who are in the WhatsApp group, you do realize that occasionally we encourage that if you have publications, you share with the group. We celebrate, we read, and then hopefully collaborations come out of that. The second objective is to strengthen external communication and visibility. So the first was to deal with the in-house communication, and now this is how we present our family to the world outside of our family. We were going to do this by strengthening social media presence with active social media accounts, i.e. LinkedIn, Instagram, Facebook, and what have you. We were going to indicate this, or the indicator for this was increased followers engagement, increased social media mentions and coverage, such as number of visits, page views, and average session durations. So for example, if we had our webinars, and then we had it on social media, or if we had an event and we publicize it on social media, we will track our improvements by the number of people who are visiting the pages, who are liking the post and commenting, giving general feedback on how we're doing. The second was to develop press releases and engage with the media. So at this meeting, we ideally would have been the ones facilitating interviews with media, TV stations and what have you, and then updating the websites, which we have here as our deliverables, press releases and media coverage, frequently updated websites to attract viewers. The indicators would have been the number of media covered events, number of articles, news segments, surveys, interviews with external stakeholders to gauge out the awareness levels that we have outside of our network, and also the number of inquiries or feedback submissions concerning our communication efforts. Additionally, we would have used increased website traffic and average session durations to also measure this goal. We also plan to monitor and track WAASuN event participation by external partners and stakeholders. We hope to do this with consistent branding and increased event participation. And then to indicate or to measure this impact, we would have had increased brand recognition and event engagement. And you've seen our logo. You have to go close up to the logo to actually read West African Aedes Surveillance Network. We want to get to a point where when you see the logo, you don't need to actually look at it because you can recognize us by our events and programs. And so this is what we plan to do with this. The third objective for our subcommittee was to support advocacy and awareness by developing materials, campaigns, and messages. The deliveries for this was to produce advocacy material, campaign reports, and messaging frameworks to increase awareness, policy engagement, resource allocation through a number of surveys. We are going to measure this also with the number of stakeholders that will reach out to us and those that we will reach with through our communication plans. And additionally, the percentage of targeted stakeholders who would be expressing interest in working with the network. At this point, I will end the presentation of what we've done so far and kind of give an assurance that by the next year, we'll have something more concrete to share with you. Thank you all.
Thank you. Thank you very much for that brief presentation. She is now going to welcome comments, input, and observations. Thank you.
Mr. Shabi and Co, who helped us to kind of put our objectives and goals into these three. Okay, so for all of them, we have it split. We have them split into the objectives, the activities and deliverables and indicators. So the part where we would have had timelines is where we're slacking a bit, and so we'll do that for you.
Comment, observations. Thank you very much. I don't know, Dr. Joe? Okay, I have the honor of calling on monitoring and evaluation. Monitoring and evaluation, are you ready? Monitoring and evaluation. What? Yes. I don't have the list here. Joe. Okay, can we move on to resource mobilization? You have not escaped monitoring and evaluation. We'll come back to you. Resource mobilization, please. A round of applause.
Okay. So as I said, Manny doesn't like too much noise. So I'll not speak very much. Yes, so resource mobilization. The team is made up of myself, Audrey, who couldn't join us this time, and then my director, because she was with us, I think, in Côte d'Ivoire at the time when we were forming these groups, and so her name was also included, and then there was some other person I've forgotten. So we're actually about 3 or 4. And so it's still, the membership is still open if people want to join. I think there are people who have a lot of ideas on. Malu, I think we have to add you to the list. Yes. And anybody who wants to join the resource mobilization group. And I will kindly also add Eva. Eva, you are going to be a member of the resource and mobilization group of WAASuN. Yes. So you've been added to the group. So yes, our role is to make sure that we have funding to support the activities. You know, you can't have a strategic plan or an M&A plan and you don't have funds to carry out those activities. So over the years, we've been working very hard. Since the inception of WAASuN, we've had our major funder have been with the CDC, Center for Disease Control, through the hard work of Audrey Lenhart, and most of you know her. And so over the years, we've received some funding to support the organization of our annual meetings, but then last year in Senegal, I did indicate that we really need to start looking at diversifying our resource mobilization plan, because as if I knew what was coming at the time. So important that looking at ways that we can generate funding from other sources. And we had an idea of things that we wanted to do. It is sad to say that for this meeting, just as we were planning and we actually were trying to elevate the standards from Senegal, Cabo Verde. So we started somewhere very high up, and then immediately there was this sound. Everybody we just started killing down. And you understand what I mean? Because we were very sure that we either have to re-strategize and have the meeting, or we postpone the meeting to next year because of some of the issues of funding. But then we decided that we would still have a meeting, but we'll try to discuss with members how we can be able to get people here and then have the meeting and then discuss during this meeting what the way forward. So in the afternoon, I'll be presenting on WAASuN, generally on all the issues about WAASuN, including resource mobilization, some of the ideas I have or we have as a group. And then we can discuss that in detail. But just to say that Audrey is still trying. I've had discussion with her to still push to get some funding for us. It's not 100%, you know, it's not something that is a pledge. You know, first we could say, okay, I have this for you, but now it's very difficult to say that. So we are still exploring the possibility of getting some support. But I think we should also look at other means. The other main source of our fund, of our resource, has been through dues. And dues are very important because you realize that we are doing several projects. Some of the projects we are doing include most of you know, these population studies that we are doing across member countries. Population genetic studies, which is being coordinated by Dr. Joanna. We're getting very interesting results. And we use some of these funds to, you know, pay for DHL you know, and other costs, even recruit research assistants to work on those samples that we will send. And also website development. We also pay for hosting the website. So some of the dues that you pay is what we use for some of these things. So we really need to also commit ourselves to paying our dues. So that also helps to do some of the activities. So generally, I would say it's not all gloom. It's not, you know, too bad, but we are still working with all our partners. WHO TDR has also supported over the years, you know, financing young scientists to attend meetings, and also some of the funds have also helped us to organize our meetings. This year, we were fortunate to have WHO again coming to us and say, okay, we have this annual meeting we do with a global biodiversity information facility. We want to do it in Africa, West Africa. Are you ready to host it? Yeah, well, that is good, because for us, it also helps us to, you know, train our members and also support some of the resources that we have. And I'm told that probably that funding is going to end this year from WHO TDR. So that source is dry now. So we still have to think around. And I know most of you here have ideas. So in the afternoon when we are discussing resource mobilization, please bring all your ideas so that we can all put together our efforts to get funds too. Because we are doing fantastic. And some of the comments that we get from outside, from people we work for, they think we are doing something very good. And we need to continue. Let's showcase what we are doing. And I believe we'll get funders who will be interested to support us. So that's in short what I have to say. Thank you very much. Yeah.
Prof, let's appreciate the Prof. Monitoring and evaluation. Are you ready now? Thank you. Let's appreciate Dr. Shirley as she's coming to the podium.
Okay, good afternoon, everyone, and sorry for the delay. I wasn't sure I was the one presenting. So I must apologize on behalf of my team members, including myself, because we have exhibited some tardiness in our performance the last year. But we do promise that we will do a better job this year, and hopefully next year by this time we will have something more substantial to present to everyone. So we were able to put together a summary of our objectives and some adapters, and so I'll just run through the objectives. We shared it with Joanna and Joseph. We shared it with Joanna and Joseph. We got feedback, but we haven't been able to meet to finalize this. So we're still working on things. So our first objective is to develop and implement a comprehensive M&E plan. Apparently, this is already in place, and so we may have to either rephrase our objective or think of replacing. We don't need to. We can, okay, all right, okay. So reason for which the font is in red. So for our activities, we're hoping to design an M&E framework that aligns with the network's goals, focusing on the effectiveness of surveillance, vector control, and public health interventions. And then for the deliverables, we have our M&E framework document. We're hoping to develop an M&E framework document with performance indicators. Our second objective is to identify best practice for vector surveillance or best practices for vector surveillance, put them together and, harmonize it across member countries. And so for our indicators, we listed a number of things. I'm not going to run through all of them. As I said, we have to meet and finalize this. So number 3 objective is also come up with a harmonized practice for best vector control within the member countries. And number 4 objective is to promote and formalize the sharing of information or information sharing, as well as best practices and collaboration within WAASuN member countries. And lastly, we're looking to expand funding resources for the network to support some of our activities. So, so far this is what we've done, and hopefully over the next few months we will finalize this and begin working more seriously on them. Thank you.
Thank you very much. Inputs, please. Nara, Mike, please.
So thank you so much for pressing the point of activities of the committee and how to measure after. Only I have a doubt about what is the real function of the committee. For the name, I understand that that is an important function for us in WAASuN, like some committee to follow and ask the people to do the thing that before was not doing. So like do the following, the really following for all the WAASuN activities and things. I don't know if I see this reflects in the activities you present here. So I have now some confusion about what is the objective of the committee you present here and the real activities for the. Thank you.
I didn't quite get you. I didn't quite understand your
Okay,
question.
the objective of the monitoring and evaluation committee for me will be other, but perhaps I'm in a confusion. So I think this committee have to monitorize the WAASuN like a net, the function like a net, but perhaps I'm not understanding really what is the function of the committee. For this, I not now put in a draw your objectives and activities. Sorry.
Yes. So she. Okay. I wanted to ask.
That's the same point I was going to make. That I think one of the critical role of the MNE is to monitor all the various other activities within the groups, especially the MNE plan. So an MNE plan captures all the activities that we intend to. So one of the critical role of the MNE is to track all these activities at different stages and then also set up a framework for reporting those activities. So we know if we are making progress or we are slowing on some of the activities. I think that will be a very critical role of the MNE. More like she said, Lars, is to more like the providing oversight and looking at all the other activities of the network and reporting to us on the progress so that we can get people to work if they are not, for instance. Yes. Thank you.
Yeah, in the same line, I think you saw the comments when we received your proposal and TOR. I said we had this already. I think you remember I made the comment that we had this already. So what the subcommittee will be doing is like monitoring and evaluation of our monitoring and evaluation plan. Yes. So that you guys make sure that what we put there is achievable and then also timely done. So if one of the activities, like we said, okay, in the first quarter, we need to have a webinar, and we know that you are marking as 20%, like this is your mark for having a webinar in our monitoring evaluation plan, you make sure that we achieve that to get the 20% that we put there. So when we are failing and said, okay, first quarter you want to do that, have you done it? So you monitor the overall WAASuN activities. So that's why in the comment I was trying to say, okay, we have this, frame it so that it can fit in the monitoring and the evaluation plan. Yeah. But I hope you have that plan. If not, we can still share it so that she did, right? Okay, good.
Thank you.
More comments? Okay, in sense of comments, observations, ladies and gentlemen, we have come to the end of this section. I beg to step aside, sir.
Thank you, Chair. Okay, thanks so much, everyone. Except the scientific committee who are trying to, do some few activities, completing the TOR, the other committees, I was a little bit dictatorial on the first presenting because I know there are plenty, like there are like 8. If 4 people can meet at a time, like at least, half of them can have a time and meet and discuss, then we go a little bit, faster. So all the committee have to make sure that they at least try to work together. And it's not in person, just online. You try to get, you can use your Sunday, your Saturday night, instead of going to Afrikiko, for example. And then you try to do something for the scientific committee, you see. So that's what I was referring to. So we decided, as Prof said, that people were engaged in Senegal. Oh, I want to do in this committee. I want to be in this committee. But it's a kind of engagement, and we need to achieve what we said. We still have room. So whoever wants to join any committee, I think we have room. It's just 10 person, 10 ideas. So you can come and join any of the group to try to improve also the activity that we want to do. It's for all of us. So It's just whatever we are doing here is a sacrifice of the whole world. So let's make time to do some of the thing. Thanks so much again for trying to convince me that you did something, but at least. Thanks again. Eugenia, is the lunch ready? Oh, who can monitor this lunch for me? Eugenia is down. Normally we can go for lunch if the lunch is ready, and then we come to do the afternoon session as early as possible so that you can close also as early as possible. So give me 1 minute, but I can still answer any questions before I check if the food is ready. Any question, comments for me? Yes.
Yeah, there was this discussion we were having yesterday that led to a spillover. I don't know if we've had that. Between Malut, Ange, and then Basil. I mean, it's something we can open up today.
Yes, that was the homework. Thank you. So I ask you to go to your chat GTP, to your Google, to your folders, and then 15 minutes. Okay, so we have 15 minutes to debate that. Otherwise, we are not going for lunch. So, yes, what did you end up with? Dr. Malu, should I give you your mic and then convince us? And after I give the mic to, yeah, that's how I'm going to do that. Convince us on the difference between the genomic sensitivity and the PCR. Ange and Basil, I don't like that. He's here. So don't convince us, but convince everybody here to make sure that what you are saying to Ange is...
No, I think Ange is already convinced. Yeah.
Is he convinced?
Ange was the problem.
Oh!
But no, to be honest, between PCR and genomics, what I understand is that for the genomics, in terms of diversity, you can have more because the PCR is really direct, except if you have a multiplex PCR. But even for the multiplex PCR, you have some target. You have, a limited number of pathogens you're gonna look for. But for the genomic, you are just screening, and everything that is present in your sample, you're gonna get it. But this is challenged with different conditions, and that's why the sensitivity is lower than the PCR. That's what I was saying yesterday. You can, and this happen every time. You can have, for instance, in Senegal, talking about dengue and mosquito. Usually we detect dengue from mosquito. And when we go through the sequencing, for most of sample, we're going to lose the virus. And this is something, normal. That's why some people are, taking what they call a threshold for the CT value, which could be because depending to the range of the CT value, you can have, your more DNA, RNA or things like that. And that's why for some people, for instance, up to 30, they will not go through the sequencing. And even for the PCR, sometimes people are just considering the sample as a negative one. But below, when you are in 20, in 18, things like that, you have a lot of material and you can do your sequencing without any problem. This is just what I was saying.
Thanks very much. The debate was very tough yesterday between colleagues from Ghana, from Europe, and the conclusion is what? Can we do metagenomic without PCR? No. The problem problem is what? We need result of PCR to do metagenomic correctly. So when we are talking about sensitivity, there is no debate. We can't do metagenomic without a PCR. I don't know if you get our point. This is our conclusion. Okay, we can't do metagenomic without doing PCR. We use the result of PCR to do metagenomic. Therefore, why are you deciding to make this comparison? Sensitivity is for PCR and metagenomic for broad diversity. Okay? So, if you want to do metagenomic, you just tell to people who are doing PCR that I need a sample which threshold is something like 30, something like 28. So sensitivity for PCR, metagenomic for diversity. That was the conclusion of our debate yesterday. But we will continue this evening because we have 2 blocks. Okay. Exactly. So after I met you at during the dinner, okay, we start the debate with our colleague, and then this was the conclusion. So we will continue today. We are in the same line, exactly. That the sensitivity, no, the sensitivity is for the PCR, and the metagenomic is for the broad. But now everybody is moving to the metagenomic in order to know exactly which is circulating in the regions. Exactly.
So to wrap up.
C'est bonbon.
No, c'est bonbon. Okay. So PCR is sensitive, but when you want to get a pool of whatever you are looking for, and then you made the metagenomic to get it wider, to see, like talking about virus, how many virus can you find in that pool, like of whatever you are looking for? Okay. So, Basil, give the mic to Basil. I don't like him talk with Ange. We are in the public. I told you that people are seeing you from distance.
No, I discussed with my friend for other things, but.
Okay. Another. What do you have next? Udoka, what can you remember?
Discrepancy between diagnostic tool exists everywhere.
Yes.
Even sometimes we think that, for instance, PCR is more sensitive. This is true routinely, but you can have some sample with PCR positive. When you're gonna go to your virus isolation, you will not detect anything. But vice versa, you can also have some sample that you can detect from your virus isolation without a PCR positive. There is a lot of inhibitor for the PCR also. And just to mention that this is not surprising to see that, you know, from one diagnostic tool to another, you can have different results. This is common.
Thank you, Dr. Maru.
Just to say that I fully agree for what Malu just said, but I would like just to add that this can depend on how you store your sample. Because for culture, for example, like what you will do on the field, if you intend to do a culture behind your experiment, you need to store your sample in another way, not store in a letter what we did usually. If you intend to isolate the virus, you need to use another approach, maybe store your sample in nitrogen liquid on the field to increase the chance to isolate the virus after your experiment. Yeah.
Thank you so much. I have also one piece of comment. Dr. Eva, Yesterday, the keynote speaker was talking about like bottle testing and tube testing. She's not following me. But sometimes, I think she feel like doing the tube, like doing the presentation of the papers, so and so forth, is a little bit, difficult. Why? Maybe sometimes we think that it's even easy to do the tube than doing the bottle. Because of variation within the bottle from one hand to another one. Why the paper, let's say you get your paper from WHO, from USM, that's why we call it actually the only center to do the papers, to avoid variations. But when you talk about bottle, where you have to do it yourself, there are a lot of discrepancy, even within your own treatment. Like you have 4 bottles, you may not have the same, application standards. So that makes it a little bit difficult. And for the new molecule, for example, to avoid that, when we talk about chlorphenapine, for example, WHO is even requesting to ensure that your bottles are well coated. And then they ask you to do in parallel with, a kind of susceptible strain, Kisumu, or whatever that you can have to ensure that your bottle actually were well coated. Because don't bring, let's say, resistance because you did not actually coat very well your bottle. So that's when she was explaining yesterday, I was thinking that, okay, if I ask to actually a kind of vote for the easiest between both and the challenge between both, who is on bottle, which on tube. One thing, WHO did not allow to compare both results. Like both results are not comparable. Like, okay, if I have like 80% in my tube, I'm expecting to have 79% in my bottle. No, I think they're not allowed to compare like that because, as I said, there are variation in terms of methodology, and so sometimes the cutoff point is not even different. Today, with the new molecule, you have cutoff point of maybe chlorphenapine that is different from the standard, 98 or something like that, because there are key things that you need to look at in terms of variation on how best, even the temperature, everything like is involved in new molecules. So that debate is there. I don't know which one is easiest for you guys, but I don't know. I'm bringing it just to kill our 15 minutes.
Okay. Okay.
It's a debate. It's a debate. So.
Okay, it's not about this. Okay, maybe I'll start with that. In terms of being easier, if you ask me, both of them have easy in terms of time. You check the bottle bioassay. Easy in terms of handling. One can check the WHO. Now, remember, this idea of observing for 24 hours becomes an issue for some people. Observation conditions, where you place the tubes and the rest of them. And then for some other people, it's a lot easier. Within the diagnostic time, I'm done, I pack up everything. So, like I said, it depends on what you are looking at. Maybe for me, that's it. But in terms of standardization, the papers that you get from WHO, obviously, once the conditions are okay, start 4 degrees, and then within the time frame, number of usage, I think in terms of standardization, that's a lot easier and better. Mine. Thank you.
For our colleagues from DRC concerning the BG gates. Where is not around? Okay, no, it's okay. Because we already tested this method, but it did not work. And I would really like to know, because there is a question that coming out about, the indicator of success. How many mosquitoes they did collect from the sticky trap and things like that. We tested, Ibrahima is here, but without any really success.
About this, I think the difficult with the different tools we have, if in your context that's function. So, for example, for us, until know what is the best obi trap, we do different model prototype. The first time we are frustrated because don't function. For example, for Cabo Verde, for us, this little obi trap is not good because we need more quantity of volume, perhaps because our weather is dry and little quantity they can find in other parts. So perhaps the problem a lot of time with the tool is the proceed to adapt the tool for your reality. And in some realities function good and in other not. A sticky trap, okay. But it's a type of, it's 2 eggs, no? Yes. Mm-hmm. Yeah, but he don't give exactly answer about this. Yeah, so that is perhaps this tool is not good for Senegal, but it's good for other parts. So, and the sticky, yeah. So I think not all the tools function good in all parts. That is like our experience. For example, if you want to try with repellent, we have one time some possibility to do a project and we obtained some stuff with repellent. But this repellent was due in Europe. So I think the repellent was in this stuff functioning in Europe, but not function for the mosquitoes in Cabo Verde. So in this case, we have to look for repellent substance in our local place in Cabo Verde, and something that could be repellent for mosquitoes in one part is not the same for our mosquitoes. So that is some tools you need really to adapt for the content and can function or not. But I think he don't have like data about the evaluation of the tool, because that is the question I did and do Abdoulaye too, or more people do question about this for him. So I think he's using, but perhaps after we can ask more in deep.
Can I? Okay, Maulud, probably if, for example, regarding your question about efficacy of glue, of sticky sheets, even in Burkina, we try to make some kind of a cage, and we put a glue paper to collect Anopheles mosquitoes. What we remark that if sometimes the humidity and also the temperature can also influence the entry of and the efficacy, the stacking of the glue. So probably there is also environmental impact of that. So it will be better if we can get a chance to maybe compare or to test this trap across different ecological setup, and it will be valuable. And I think that it should not be costly if we have a trap. We can give a trap to different country. We can put, if it is Aedes, Aedes is urban, so near your center you can maybe put some trap and can collect more data and analyze to see what is the impact.
Okay, thanks, Musa. I think what you are saying is like the forest of the DRC is not the Sahara of Burkina and Senegal. So the idea is like it may work in DRC because of the condition, the ecology, and whatever it is. And so I don't know, he's not around. We can still think of that project like getting maybe 2 traps to each condition. Like the northern of Cote d'Ivoire is the south of Burkina. So for example, north of Cote d'Ivoire is south of Burkina. So what is the difference? We can know. And the southern part, those are the sea, are different. So we can maybe try and see in terms of or niche ecological condition in all the countries, we can bring it and maybe tell the supplier that, okay, better advocate for forest parts of the world. But when you bring it to Senegal or to Burkina or to, I don't know, enough of Mali, you cannot get anything because the condition there is not favorable for your trap. I think that's some of the things that we can also do to, yeah. Yeah. Where's the mic? Yeah.
It should be also a way for WAASuN, for example, to get a fund from them to test the trap.
Yes.
Yeah. Is there another way to collect funds from the manufacturer?
Exactly. We can use like few data that we have. Like Senegal say your trap is not working, and Burkina say your trap is, DRC say your trap is working. So what are the difference? So we write a proposal. That's exactly what we have to do. I said, okay, we have like 19 countries with different conditions, south, north, east. So let's see how best we can work for you, and then you pay. Yeah. So, Better Control Committee, can you start drafting something according to what we are saying? Okay, but Alia was already.
I'm taking my word back, and I will comment on what you commented on about the WHO essays, and because this is actually important.
Oh, sorry.
So let us take it like that. If your lab has capabilities, like if your sector, if you, the one or the people who are doing the surveillance and insecticide resistance testing, having lab capabilities, then the bottle assay will be a great choice for them, because it's like that, they can do it without waiting for the paper, and it is actually cost effective. Period. And this is a case. And that's usually the general case, labs, vector labs, usually do not have capabilities, like really good capabilities. So then we have to choose the WHO assay. So I think we all are coming from the same situations. We know how some vector control labs are lacking essential tools. So in this case, we have no choice.
Thank you. I think if you comment on that, I'm taking the example of Ghana where we are. Ghana have about, let's say, 40 sentinel sites where we do, for example, exercise and monitoring. Noguchi is just here. So when we talk about 40, the tests may be done in the field. So the conditions that you are talking about, you cannot meet that in the field, for example, to do bottle everywhere, for example. So that's one of the challenges that we have. So you need condition, temperature, humidity, and whatever, good condition. Even you coat your bottle, you put it somewhere, the following day you come, there's nothing inside. You know, your insecticide may be gone. You know. So those conditions are key. And the way we try to gather the data here, so that's exactly the challenge I was talking about. We are obliged somehow to rely on the papers for maybe what we have on paper for now, and challenge ourselves with what we need to do with the bottle, as I said, the new insecticides. So those are the things that actually matter for us to be able to get at least data to support whatever is doing music. But as we said, and also it's difficult to move mosquitoes from, let's say, Tamale to Accra easily. It's not working to have the condition for testing. So those are the challenges that we have in terms of, broad and large IRM data collection. Yes, Udoka.
Yeah, we still have time. Let me just change the discussion a little. When Basse was speaking, he mentioned, it's a general thing. He mentioned the issue of liquid nitrogen. And I'm very sure that's not very common among member states. And somebody introduced me to the Credo Cube box. I don't know. I don't know who are using it here. Of course, Africa is hot. When you collect samples in the field, you need to preserve them, the integrity of the virus in the mosquitoes if you must run assays. So I don't know. Is anybody here using the Credo Cube? Is there any advice on that? Because it can keep the samples, I learned, at minus 20 degrees for up to 72 hours. So just an insight into that, because we are striving to grow and to get better results. In fact, I was moved by this because I was almost certain, I could swear, that I went to a site that had multiple arboviruses circulating, and eventually all our samples turned negative. I mean, it's kind of crazy. You could find cases, you find the vectors in abundance, so I was certain that it is related to handling of the samples. So please, I don't know. Any comment on that? Any suggestions? Thank you.
Maybe Maulu can help you on that because they are doing a lot of virus and it.
No, I don't have any experience on that, but it can work. Like also the RNA later.
Yes.
You can use it, it works very well. But you are limited just molecular tools for your diagnostic. When you go through virus isolation, you will not be successful. This is the problem. The other things I would like to mention is that detecting virus in mosquito is the same everywhere. You know, the infection rate is very, very low and everywhere. You can have an outbreak of dengue with a lot of human cases, but when you go through mosquito, you have maybe 1 or 2 pool positive. What is happening is that our diagnostic tool, which are not really working very well, or you know, just the infection rate, which is very low. For me, I think, and I did advocate a long time ago for that, we need really new tools for virus detection in mosquito. Even we can go through rapid diagnostic testing. We use it in Senegal, even if the ones we use was designed for human samples. And we did got a lot of infection using this tool, and thereafter we go through the PCR to see if there is, you know, we can detect the same virus. There was just one sample among 22 that was positive, one sample of difference. And it means that we need to work on that also. We need to do this advocacy, you know, in collaboration with our colleagues working on virology. But until now, people are just thinking about human samples. Human sample. Everything is designed for human samples. And for diagnostic, when you switch from human to animals to mosquito, the things are very different. You take a Rift Valley fever diagnostic, the ones ELISA are working on a human will not work on animal. It's the case everywhere. And that's why I think we need really to have something really dedicated for mosquito population. And until now, we do not really work on that.
Thank you so much. Clap for yourself. Good. Okay, so the lunch is ready. Sorry, we're supposed to go at 1. Wait, no, we are close. You are now getting explanation when I'm closing. So the lunch was supposed to be at 1. Actually, it's 1:40. Our next presenter is online. So our starting point depends on ourselves and himself. But it was normally planned for 2:15. So it's been that we are going to eat as militaries, but I think we can still try to see if we can get maybe 15 minutes from him. So I'll come back at least at 2:30 so that we can start. So I can delay him for 15 minutes. I beg. As Prof said, we are all online. So everybody is seeing us. Everybody is seeing you. So whatever movement you are doing has been seen by the whole world. So if he's presenting and the room is empty, you will also see that. So come here. 2:30, everybody be seated and I will present. Thanks so much and enjoy your lunch. 2:30. Yeah, 2:30. Thank you. So we have like, yeah, 50 minutes, so that's fine.
sincerely apologize for that. Because I wasn't feeling well, I didn't really want to come and stand in front here, but for this speaker, I had to, because she's someone I met last year at a meeting in University of Princeton, and her talk I found her talk really fascinating. She presented something on modeling disease, the arboviral disease across Africa. And as soon as she finished, I was like, I really want you to come and talk to the WAASuN group. And it ties in very well with what we've been discussing here, moving ahead of the usual surveillance data that we have. What are we doing with all that data for our disease outbreak preparedness? Our data is sitting there. We've collected data over several years. But I think that expertise from the training capacity questionnaire we shared, people really need to do some modeling with what they have, because at the end of the day, that's the whole point. That's why we are doing this. We want to be able to predict outbreaks. So I invited her and she accepted. Before, we had wanted it to be a training session, but looking at our limited funds, we couldn't, and the time. And now our meeting is from 5 days. We've shifted to 3 days. So she felt, oh, it's too short for me to actually have. We need more time to do a proper training. So she gladly gave up what would have been a nice holiday in Ghana to just have a virtual talk to us, so that maybe next time we could have her come and do some training for us. So Jamie is a disease ecologist and a modeler, and I am sure you would also find her talk fascinating. So Jamie, over to you if you're still there. Jamie, if you're there. Can you, yeah. Perfect. So, how do we hear her? Over to you, Jamie.
Sorry, Jamie. We need to fix the sound, and then you can. Can you try again?
Can you hear me better now?
It now. Thank you. Yeah. You can start.
Great. Well, thank you so much for inviting me to speak with you today. My name is Jamie Caldwell, and I'm a research scientist at the High Meadows Environmental Institute at Princeton University in the US. And I'm a disease ecologist and mathematical modeler. And one of the focuses of my research is mosquito-borne disease. So today I'm going to tell you about two studies about mosquito-borne disease modeling, and specifically Aedes aegypti modeling in Africa. So the first study focuses on Zika, and this was a collaboration with Drs. Rose and Lambert. I assume everybody in this audience knows about Zika, but it's a disease that the kind of most devastating effects are when newborns are born to mothers who have been infected and they can get microcephaly. And it was first reported in the Zika forest in Uganda. And this raised some interesting questions and led to what we often think of as a Zika paradox. So even though Zika was first reported in Africa, if you look at this map of the global distribution of Zika burden, where warmer colors are showing higher burden, what you'll notice is that there's actually very low burden and it's very patchily distributed throughout Africa. And that's particularly surprising, not just because it was first reported there, but because the conditions seem very highly suitable to transmission. The climate is suitable across the continent for most of the year. The mosquito vectors that spread disease, Aedes aegypti, are widespread. And we know that there's highly transmissible forms of strains of the virus circulating in primate populations. So then a key question arises, which is why don't we see more Zika in Africa? And how can that inform us about the disease more broadly and potentially mitigation and preventative measures around the world, as well as in Africa, if it were to be a problem in the future? So the way we addressed this was to look at these hypotheses independently and together. So our first is focused on climate. And what you see here is a really classic curve between transmission potential on the vertical axis and temperature on the horizontal axis. And it's essentially showing where transmission is optimized. And you see that it is around about 29 degrees Celsius. But what's more important here is that there's actually ranges of temperatures that are too hot or too cold, so they constrict transmission. And that means that perhaps even though we largely think of the continent as suitable from a climate standpoint, it might be that certain regions or times of year really are restrictive. The second hypothesis focuses on the mosquito ancestral lineages. So as I think everybody knows, there's these two predominant subspecies or forms of Aedes aegypti. We have Aedes aegypti formosus, labeled AAF, and Aedes aegypti labeled AAA here. And so the Aedes aegypti formosus is an ancestral lineage to Africa. It's only found there. While its counterpart left Africa and started specializing on human hosts. So it's really effective at biting humans, and it's a really competent vector of Zika, along with other diseases like dengue and chikungunya. However, Aedes aegypti has returned to Africa, and it's hybridizing. So there's populations that are predominantly that AAF, the ancestral form or lineage, and predominantly AAA, and then a hybrid in between. And so these differences, you can see there's this coloration difference or morphometric differences, but it also maps onto genotypic, phenotypic, and these behavioral differences that I was talking about in terms of their biting preferences and their competency as vectors. So the way we approached this was essentially to have competing models and see which one fit the data in real life best. So our first model looked at the features of the system that are affected by climate. The second looked at the features affected by that mosquito ancestry. And then we had a third model that combined both the climate-dependent and ancestry-dependent traits. So in terms of climate, mosquitoes are small-bodied organisms, and so they don't regulate their internal temperature, and the ambient temperature outside is what dictates their metabolic traits. And there's a suite of metabolic traits that are really important for transmission. And these include things like how often they bite, how long they live, their extrinsic incubation rate, their probability of getting infected and becoming infectious given they've bitten an infected host. And so what I'm showing here is the relationship between these traits and temperature on the horizontal axis. And the points that you're seeing are from laboratory experiments, and the lines are the model fit. But the only thing I want you to take away here is that each of these relationships has this hump-shaped curve where you have a temperature range that is optimal for transmission and ranges that are restricted because they're either too hot or too cold. So that's why we saw the curve I showed you originally between transmission potential and temperature. In terms of ancestry, we have two traits that we looked at: the probability of the mosquito to bite a human versus a non-human host, and the probability of the mosquito becoming infected and passing on that infection. So in this plot, we're looking at the probabilities on the vertical axis and the human specialist ancestry on the horizontal. So that's a little bit unusual, so just take a second to explain that. Essentially, if you have 0% AAA on that horizontal axis, it means your population is entirely made up of the Aedes aegypti formosus, or that ancestral lineage of the mosquito, whereas 100% means you're 100% the Aedes aegypti or the human specializing mosquito. So in both of these plots, what you see is an increasing and then saturating relationship. So this essentially says that the probability of biting a human and the probability of mosquito infection both increase as you increase the proportion of the population that's made up of the human specializing mosquito. And then our full model incorporated all the traits together. So let's move on to the results. The way we validated this model was a little tricky, actually, because we don't have great data on Zika virus infection. So what I'm showing here, the points are field sites where Dr. Rose collected data on the mosquito population and conducted experiments. And so we used that information to create the models. And then we did an external validation from all the sites shown in yellow. And what we compared our model predictions, which was essentially suitability or transmissibility potential, with seroprevalence data, which is a population measure of prior exposure to Zika based on antibodies in the bloodstream. So it's not a one-to-one match, but we expect a strong correlation if our model is predicting accurately, because in places where you'd have a higher reproductive number or increased transmissibility potential, you'd expect higher seroprevalence in the population. And so let's look at what we found. I'm going to show you a series of scatter plots for each of the model results that look like this. So here we're looking at the model that only incorporated the climate-dependent traits, and we have the seroprevalence estimates on the vertical axis, and our model estimated our matter transmission potential on the horizontal axis. Anything to the right of that dashed vertical line is indicating that you can have outbreaks or epidemics, and anything to the left of that one is indicating that outbreaks should be suppressed. Now, each of the points indicate a different country, and the coloration indicates which country we're looking at, with the line showing the uncertainty. And the ellipse is showing the 95th percentile. I'm seeing a chat, so I'm just going to check it in case there's a problem with hearing me. Use your cursor and please slow down. Yes, I'm sorry. Okay, so to the left of this dashed vertical line is where we can see epidemics. And sorry, to the right, and to the left is where outbreaks should really be suppressed. And so the fit between the line and the points is 30%, which means our model is explaining 30% of the variability in all the seroprevalence data across Africa. That's actually pretty good because it's not only incorporating temperature-driven traits of the mosquito vector. So the ancestry-only model explains a little bit more, about 6% more variation in the data. But what's really important here is that all of the points are now below this vertical dashed line at 1. And that aligns much more closely with our expectations because we really don't see or hear about Zika outbreaks in Africa. So I think that 6% increase in fit of our model to the data isn't really explanatory of how much better this model is when it incorporates mosquito ancestry. And when we incorporate both climate and ancestry, we do even better. So it means if we're only incorporating the temperature-driven traits and the population ancestry of the mosquito and its effect on biting and infection, we can explain 46% of the variation in all the seroprevalence data in Africa that we could collect. And you can see the strong effect of the mosquito ancestry here because all of the points are below 1 and they aligns with expectations because we don't see outbreaks often in Africa. So this shows that both climate and ancestry are important, but ancestry is predominantly responsible for why we're not seeing bigger outbreaks in Africa. But beyond the model fit, the more important thing is what this model tells us about our understanding of Zika transmission in general, or even more largely Aedes aegypti transmitted diseases. So here we can look at that transmission potential on the vertical axis versus human specialist ancestry on the horizontal axis. And we see this similar increasing saturating curve. But what's important here is that right at the very beginning of that curve, you have the steepest slope. And so what this tells us is that as you go from an entirely ancestral lineage population of mosquitoes in a location to adding just a small percentage of that human specialist mosquito, you get the biggest increase in transmission potential. And that's where you see the jump going above 1, which is where you start to see outbreaks emerge. We see a similar relationship for temperature. Here, the relationship between transmission potential and temperature also has a range of temperatures where the curve is steepest. And so what this means is that in this range, a small increased increment of temperature can disproportionately increase transmission potential. So if you look at the two together, here we have the human specialist ancestry on the vertical axis and temperature on the horizontal axis. You get this U-shaped curve of transmission suitability, of increasing transmission suitability. And the points, the white points right here, are all the sites where we had seroprevalence data. And you could see the majority of them are falling in this area below 1. But what's concerning here is that our projections for increasing temperature from global change and urbanization, which affects the population makeup of the mosquitoes, are both increasing. And so that suggests a lot of places in Africa are actually on the cusp of becoming highly suitable for Zika emergence. So there's a couple of caveats here. This is assuming that the relationships we've captured in the model are correct, as well as our understanding of how temperature and urbanization and its effects on mosquito population are correct. And it doesn't account for any human behavioral changes, interventions, etc. So this certainly doesn't mean that Zika will become a huge problem, but it's something to consider and watch out for. And so then we wanted to know, can this tell us about where we might be concerned about Zika emergence? So next we looked across the 60 most densely populated cities on the continent, which are shown here. And based on our model predictions, 39% already have conditions suitable for Zika if it were to spill over into a human population. But by the end of the century, another 37% will enter that suitable range. And so together, that means by 2100, 3/4 of the most populated cities, meaning cities with more than 1 million people, will have the conditions that would allow Zika to emerge and spread. The positive outcome of this is that mosquito ancestry is actually cheap and relatively easy to monitor. You capture mosquitoes and sequence them. And so it can be a really simple way to monitor and evaluate different locations for potential emergence, and then really tailor any potential interventions to specific places that are at risk. So the next study I want to talk about is focused on dengue, but using a very similar Aedes aegypti model to ask, can we actually predict outbreaks if the conditions are there? This was a big study with about 17 collaborators from the institutions shown below, so I'm not going to name them all, but everybody was truly helpful in making this work come to fruition. So the first thing we did was take this model and do some simulations without data at all to understand how temperature in particular can affect outbreak characteristics. And then can we use that information to actually predict transmission and incidence through space and time? So here what we're looking at on the horizontal axis is mean temperature of a location. And on the vertical axis, we're looking at temperature range, which is essentially the difference between summertime and wintertime temperatures. And so you can look across the space of what most places in the world experience and see that there's this band of highly suitable conditions for epidemics. And I have pointed out Accurate here is sitting right in the middle, as are a lot of places in Africa. So understanding more specifically dynamics through time can be really useful. We similarly ask questions about how temperature influences the types of outbreaks that would emerge. So here on the vertical axis, we have final epidemic size. So it's the proportion of the population that would be infected. And on the horizontal axis is the starting temperature. And what I mean by that is the temperature when the outbreak starts. And so what we see is that the largest outbreaks occur when outbreaks start around 24 or 25 degrees Celsius and when the temperatures are on the rise. So that means if you have an outbreak that starts in spring going into summer, that's when you're likely to see the largest outbreaks due to temperature. On the other hand, we see that outbreaks actually last longer when they start in the cooler periods, in the fall or winter. And so here we're looking at epidemic length, or the duration of the epidemic on the vertical axis, and again, the starting temperature on the horizontal axis. So simulations are great, but we don't know if they actually explain real-world dynamics. So that's what we wanted to ask, and we did that by comparing these models with dengue incidence data from these 4 sites shown here in Kenya. Now, we did largely find some alignment between our simulated predictions and what we actually saw in the field. And that's that the model did a fairly good job of predicting the total number of outbreaks at a given site, shown on the scatter plot on the left, the peak timing of outbreaks in the middle, and the outbreak duration or length on the right. So in each of these scatter plots, the model predictions are on the vertical axis and our observations from the field sites through time are on the horizontal axis. And so we are getting a correlation between about 50 and almost 80%. However, the models did a really poor job of predicting outbreak size or peak incidence. And that's important. So it means that although the models are doing a fairly good job at predicting where and when outbreaks will happen, we still have a lot to learn in terms of projecting exactly how many individuals will be affected. So from these types of models and analyses, we couldn't actually tell a clinic or a hospital how many beds they would need at the peak, but we could tell them when we would expect the peak to happen. And that's probably for a variety of reasons, including the fact that many of these diseases have a high asymptomatic rate. Reporting rates also vary quite a bit, but there's probably other factors that we're simply not incorporating into the model that are obscuring our ability to capture the magnitude of the outbreaks. So this is just an example of incidence through time, comparing the model predictions and observations. So here we have incidence on the vertical axis and year on the horizontal axis for 2 sites. The black line dots connected by lines are the observations. So these are monthly observations over about 5 years. And then the gray is the model predictions. So what we see is by and large, when the model predicts low incidence or high incidence, we do see correspondence in time and space, but not all the time. And what we're showing here, we've actually scaled the model predictions, but we don't actually know what that scalar should be in real life. So essentially it'd be like multiplying your predicted incidence by a reporting rate, but we don't know what the accurate reporting rate is. Only after the fact could we do this and estimate. We did look at a number of features to try and understand where the models were doing better and worse. And these are just two examples of what could influence our predictability. So here on the vertical axis, we have our site level correlations. And then on the horizontal axis, it's different characteristics of the villages or cities that we were working in. So what the scatter plot on the left shows is that the model predicts better in places where a lower percent of the population is under 5 years old, potentially because after a certain number of years, you're more likely exposed to dengue and less likely to be captured in the data set as having been infected. Conversely, we see that predictability is better in places where houses are made of cement. This is just one of many sort of housing and village characteristics that we looked at. And essentially, we were consistently finding that the infrastructure of the homes was affecting our predictability. So places where more of the houses had open eaves or less temperature control that would make it cooler in the homes, those were places where predictability was worse. One of the things we found from this analysis is that the breeding microhabitats within the village were incredibly important. So these are pictures of just a couple of places around our field sites where mosquitoes were breeding. The picture on the left is a recycling center, but likewise we found similarities with dump sites. So when they were uncovered, rain would collect in these containers and it became a great breeding ground for mosquitoes. We also, not surprisingly, found a lot of mosquito larvae in tires that had filled with water. And similarly, but less expected, was that we found rainfall pooling in things like half-open coconut shells. And so we were partially expecting that containers that people used and left out for water, especially in villages where they didn't have consistent pipe water in all homes, would be the breeding grounds. But in fact, those water sources were really well taken care of and covered. It was sort of these non-use or unexpected microhabitats that were really breeding a disproportionate amount of the mosquitoes. And as a result, it meant from location to location that we looked at, the influence of rainfall on dengue transmission was really context specific. So I think everyone here knows, but just to highlight that freshwater availability is super important for Aedes aegypti because a lot of their life cycle depends on freshwater availability. And so in places where that fresh water is not able to pool anywhere, the relationship is easier to understand and predict. But when you have these human modifications to the environment, you have non-use containers out, for instance, that are filling with water, it sort of disrupts that expected relationship, and we have to reassess how that's incorporated into the analysis. And what we found across multiple sites and countries is that that really does have to be adjusted from location to location to accurately predict dengue dynamics through time. And the final thing I wanted to bring up is we used this type of model to develop an online tool for the Ministry of Health in Kenya, where you could look by county at expected mosquito abundances throughout the year and how they would change in what we call a normal climate year versus an El Nino or La Nina year. And the idea here was that if resources become available and dengue is a concern, this could be used to really optimize the timing of when interventions like vector control would be deployed, so you wouldn't waste resources unnecessarily. So overall, these two studies really showed us that mosquito lineages and climate together can shape both the current and future Aedes-borne disease distribution in Africa. We saw that from the Zika study, a number of locations in Africa might be on the cusp of potentially highly suitable sites for Zika transmission. As we can see from this contour plot showing how changes in temperature and human specialist ancestry would increase transmission suitability. And in physical space, that maps onto about 3/4 of highly populated African cities potentially becoming suitable for Zika by the end of the century. But using these same tools, we can predict how the trajectories of an individual incidence in an individual location can change through time and use that to help prepare and respond to outbreaks. So thank you again for having me. I'm happy to take questions here. I'll also leave this up for a few minutes. This is my email address if anybody wants to get in touch, and QR codes for the two main studies I was talking about if you want to read in more detail.
Thanks so much, Jamie. I think we have time for some few questions. So
sure.
I'm opening the floor for questions for Jamie. Go first.
Yeah, thank you very much, Jamie, for the presentation. I think most of the time I kept wondering and trying to play catch up, but it's fine. This study is specific for Aedes species. I hope I'm correct.
Are you asking if this is specific to the Aedes species? Sorry, I can't hear you that well.
Yeah, Aedes aegypti specifically, I suppose. So I was wondering, is there a chance that given the spread of Aedes albopictus in Africa now, is there a chance that it can follow the same trend given their temperature preferences? Thank you.
Yeah, that's a great question. I don't think people are asking enough questions about Aedes albopictus, actually. The short answer is we don't entirely know. The longer answer is that we do know the temperature preferences of Aedes aegypti, and they do differ, or sorry, Aedes albopictus, and they do differ from Aedes aegypti. So we could rerun this model to a certain extent with Aedes albopictus. We don't have as good experimental data on some of those traits that are important. However, there's a couple other important factors, I believe, where they breed and bite differ a little bit from Aedes aegypti. And we also don't know if there's any, I mean, as far as I know, there's no ancestral lineage equivalent like there is with Aedes aegypti. So I think those things would be important to determine, but certainly we're hearing more about Aedes albopictus. We know they are actually competent vectors. We know they've been found with virus in their midguts when outbreaks have been happening. So I think there's certainly a vector to consider and watch out for and analyze a bit more closely.
I have, thank for this nice presentation. I have just one question concerning the ancestry. Maybe I missed something, but it's very difficult for me to understand how you did proceed to estimate and to have the evolution. Thanks.
Sorry, I didn't totally catch the question there. Could you repeat it?
Yeah, my question is about ancestry. How did you proceed to estimate it?
Okay, so I am not the expert here. Dr. Noah Rose did this work, but essentially, mosquitoes were collected in the field, their genomes were sequenced, and then the proportion of the population in each of those locations were assigned to Aedes aegypti formosus or Aedes aegypti aegypti. And those mosquitoes were also incorporated into experiments. Can you still hear me? Okay. And so the experiments for the biting preference were in these chambers where there was human odor and guinea pig odor, and the mosquitoes could choose where to go and bite. And I should have put some videos in here because it's astonishing. All the mosquitoes go to the human odor, and very few go to the guinea pig as a representative of another host. I think what's missing here, and in general in terms of our knowledge, is that even though we know they prefer human hosts, the Aedes aegypti aegypti, we actually don't know how important the availability of hosts is. So they may prefer the human odor, but if there's no humans around, they're obviously going to bite other mammalian hosts. So based on the mix of humans and non-human hosts available, that could strongly affect the relationship there. And then in terms of the ancestry of the probability of infection and becoming infectious, that was done by our other collaborator, Dr. Louis Lambert. I believe the mosquitoes came from collections that NOAA helped collect, so from a lot of those same sites. But then they were brought into a lab and put in experimental chambers with mice. And so they could see where they were feeding, and then they would also take blood from the mosquitoes after feeding on mice that were infected and see the proportion infected, and also then they could expose new mosquitoes to the mice, and they then analyzed how many new mosquitoes that weren't previously infected became infected after feeding on the mice.
Yeah, thanks, Jim. The people to introduce themselves so that at least you can know you were talking. First person asking the question was Dr. Uduka from Nigeria. The second one is from Senegal, Dr. Maulud. Introduce himself.
Thank you to give me the floor. James. I'm Basil Kamgang from Cameroon. Yeah, follow the first question about the presence of Aedes aegypti in many countries in Africa now. I saw that in your model you based on the presence of Aedes aegypti. In several Central African countries, in a location where both species Aedes aegypti, Aedes albopicus are found, Aedes albopicus is the predominant species, and in some cases replace completely Aedes aegypti. And also, the previous work of Phil Lunibos demonstrate that Aedes aegypti tolerate more the high temperature compared to Aedes albopicus. Based on all this, after maybe a couple of years, 5 years, 10 years, this model can still valid in the Central African context, for example. Thank you.
I'm so sorry. So I missed a lot of that. Was the question in 5-10 years if Aedes albopictus is more dominant across Africa? Is that right?
Yes, I'm saying that in many Central African countries, currently Aedes-Borne is replacing Aedes aegypti.
It's already replacing Aedes aegypti.
And for your model, you work only taking into account the presence of Aedes aegypti.
Okay, so and please correct me if I'm mishearing you or misunderstanding, but essentially the real concern is Aedes albopictus, especially in Central Africa. Is that correct?
Yes.
Sorry, Jenny. The idea here is like you show a model using.
And I think you mentioned that they prefer lower temperatures, which is true. So I think it would depend on the specific location as well as the habitat makeup, because Aedes albopictus isn't as urban dwelling a mosquito, although they can thrive in urban habitats. So there may be some compensation there, even if the temperature is more suitable, because 29 degrees is actually really high. I think Aedes albopictus prefers about 27 maybe, which is probably more in line with a lot of locations. I would guess they might be more found in peri-urban or rural places than urban, but I'm not entirely sure. So in that case, there may be a lower density of human populations that they're interacting with. Is that what you're finding?
Jamie, the problem here is that, there is competition between the two species.
I'm not hearing anything anymore.
You don't hear as a link. Okay, let me go there.
Perhaps somebody could type the questions into the chat while the person is asking. Oh, yeah.
When Aedes albopictus is introduced somewhere, there is a competition between the two species, Aedes aegypti and Aedes albopictus, and usually Aedes is why it's a bit difficult for us to understand, to build the model only with Aedes aegypti.
Okay. So the albopictus are completely outcompeting Aedes aegypti. Yeah, so I think that's completely fair. I would not take results of a specific model and apply them to the application like Aedes albopictus, especially because the population makeup of the Aedes aegypti is so important in the outcome of this model. So I think in order to apply this approach, you'd really need to reparameterize it with the information like this. Actually be able to do that without running the like expect the outcome to be. I think in terms of the climate, it might actually be more suitable for transmission. But I couldn't say for sure without doing it. So that's really hearing that. Sorry, you kind of. Would you mind saying some of that again or take?
Can you hear me?
A little bit.
Type or you can get the team. So thank you so much again for your time. We hope that in our next conference you can join us so that the question.
Thanks for having me. I really appreciated the opportunity.
The difference between in-person and anyway, so we have also the link of the paper that she shared. We can get through, and if we need to discuss some of the aspects, it can be our own, as I say, homework to bring out some of the discussion that they have there, which may be controversial. For example, from what we are actually seeing on each of the countries that we have, we can bring up that story, and whenever we meet Jamie, I think we can discuss that further. So let's continue thinking as researchers. And one example is not overall example. It's not the Bible words. We need also to dive in and see what fits in our context. Yeah. So thanks so much again for on behalf of Amy. See you. Is it okay? So we are now going to talk about WAASuN, and then let's see.
Good. Thank you, Joseph. Good afternoon again. So, the next 1 hour, I'm going to talk to you about WAASuN. And this one is for all of us to contribute to making sure that we are just more of an update what we've been able to do from our last meeting in Senegal. Some of the things we wanted to do, I'll just give you an update on that. And also for those who will be joining or who are joining us for the first time, just give you a little background on WAASuN. Like a discussion on what so it's not, I'm not making a presentation. I'll just question and I can go back. So just to show the relevance of WAASuN, even after about 9 years ago when WAASuN was formed in Sierra Leone, at the time we didn't even have any clue we're going to have this kind of bedding of arbovirus, especially dengue. And just looking at 2023 figures and the 2024 figures, we think that role to play in helping our country. So if you look for out of about 27 countries that recorded outbreak of dengue, 25 of them were from West Africa. So it actually shows that we still have a lot of work to do. And of course, surveillance is key in allowing us to monitor risk and also predict disease outbreak. And this is in line with global vector which has one of its pillars as monitoring risks for disease prediction, which is key, in mitigating the threat. So I just put out this to show that we are still relevant. So the back it was a meeting with a few medical entomologists in West Africa and convened by CDC. Meeting in, I think it was during ASTMH, and I met Audrey and Rebecca Livin, and they wanted to kind of organize a meeting in West Africa and try to support, they had some to support West Africa build their, wanted a best youth that Hello? Let me try this out. Yeah, so, sorry, they wanted the best use of the money, and I suggested that, first and foremost, at that time, we didn't even know the capacity of countries relative to arboviral disease. So we should have a meeting to get all the countries coming, and then we do a capacity assessment, and through that, we can be able to decide on what to do. And it was during that meeting in Sierra Leone that we decided to form a network. And some of the founding members are still here. And at that meeting, myself and Mamadou, the late Mamadou Koulibaly, may she so rest in peace, passed away last year, were asked to lead the network. And then, of course, other executives also came on board to steer the affairs of the network. So we have a vision, we have a mission, and all geared towards strengthening surveillance capacity in countries, especially West African countries, and also advocating for funding, among others, other objectives. But our key strategic areas of activities are centered on first strengthening and expanding regional capacity for Aedes vector surveillance, and also formalizing and also encouraging information sharing. But long term, to sustain the network, build long-term sustainability of the network, and also through collaboration and partnership. So these are 4 key strategic areas of activities. Currently, WAASuN is registered in Ghana as a non-governmental organization, and our certificate of incorporation is there. That's a picture of it. So we are a legal entity in Ghana, and currently we have, if I'm right, over 150 members, including from West Africa, Angola, Cameroon, and DRC, who have been with us since the inception of the network. From focal persons, countries have focal persons for WAASuN. And we have also a strategic plan, an M&E plan that was developed and is being implemented currently. The organogram of WAASuN. So some of these units are still under development. For instance, the advisory board. We had some colleagues, senior colleagues, who were members of the advisory board. Fortunately, one of them passed last year. I don't know if most of you remember Professor Wilson. Professor Wilson was with us, if you remember, we're together with Prof. Boache, so passed last year. together, and also Professor Maxwell Apau were also members. And so the advisory board still, we still need to reconstitute the board. If you have anybody in mind, in your country that you think should be a member of the board, please send the names to the secretariat, and then we'll try to get them to be part of the advisory board. Of course, then we have a chair, we have a vice chair, and for the purpose of some of you who are joining us for the first time, I want to make sure I introduce all the executives so that you know them. So myself, the chair, we have the vice chair, Mama Malu. Please, can you stand up so that they see you? So that's the vice chair, Malu. And then we have the executive organizer. Where is he? I can't find him. He's here, Joseph. And we have the secretary. Secretary is Joanna, Mr. Joanna. The deputy is Emelda from Nigeria. And then the financial secretary is Selassie. Later, I think somewhere along the line, we realized we needed someone to help us with our media and communication. So we added the media and communication specialist, who is Andy. Andy, are you here? So he's been supporting us. And of course, being supported by Daniel. Is Daniel here? Daniel? Yeah, okay. So Daniel has been working very, very well to make sure that our media and communication strategy, is well developed and implemented. So 2 years to have some subcommittees, and these subcommittees, as I discussed earlier, I think there are 5 of them, if I'm right, are supposed to help support the network in different areas or different activities. So let me take you through some of the things we've done since the inception of the network. So as I said, the network was formed in 2017, and 2 years after that, we managed to mobilize some funds to have our first meeting in Accra. So our first meeting was in Accra, in 2019. So we started from Accra, from Sierra Leone and then to Accra. And of course, because of COVID, a few years passed, we couldn't have any meeting. But 2022, we were able to meet in Côte d'Ivoire, hosted, by Joseph and the team. And then in 2023, we were in Cabo Verde. Also, Sylvania, are you here? Sylvania? Yes, Sylvania and Davidson. Davidson, yes. And Lara, is Lara here? Yeah. So they did a fantastic job hosting us in Cabo Verde in 2023. And then last year, we had the opportunity to be in Senegal, Dakar. Also posted by Institut Pasteur in Dakar, Malu and the team. So we had a good time in Senegal, and the standards, both in Cabo Verde and Senegal, were at that level. I hope you agree with me, right? For some of you who were there, it was really exciting being in those two countries. So we've had those, but as part of the meetings, we also try to have some workshops and also build capacity of our members. And so the first meeting we had in Accra, we had a training on molecular detection of insecticide-resistant markers in Aedes. So that's the picture you see on the right. That was the first meeting, workshop we had in Accra. And you can see Malu, a very serious student at the time, listening attentively. And after that, we also, in Côte d'Ivoire, organized a training on morphological identification of Anopheles defensi. And I'm happy to see that the facilitator, the only facilitator who really took the whole group through this technique is here with us. Can we see you earlier? Yes, thank you very much for helping us facilitating that meeting. So it was a great time we had in Côte d'Ivoire. So really so again on building. Last year we health organization in Senegal. So they partnered us, and their role was to organize a training workshop for selected participants. And the workshop was on molecular identification of arboviruses in mosquitoes, using molecular methods. And Malu and the team facilitated that. So it was really, and the participants were given certificates, and some of them you see also there. So that was something we've been doing, working with some regional and global bodies in building capacity of our members. So in somewhere during COVID, 2020, we actually didn't have any meeting, but we had a virtual meeting. Actually, we had a symposium at the ASTMH, which was virtual, and we had some presentations from some of our members. With Florence, Dr. Florence Folk from WHO TDR was part of that team. Rebecca, myself, and Malu, made presentations during that symposium. We've also been working with other partners. Some of you know about RAFT. RAFT is Resilience Against Future Threats. So they also organize webinars, and we have also taken part in webinars and discussed things around Aedes-Borne diseases. So in terms of resource mobilization, as I indicated earlier, our main funder has been CDC Atlanta, through the effort of Dr. Audrey Lenhart and the team in CDC. And we also have had some supplementary funding since 2023 from WHO TDR. So they support, especially the interest of Florence at the time was to build the capacity of very young scientists or young researchers. So we try to bring in students, master's level, PhD students, to come to the meeting and present their work, and they were funded through the support from WHO TDR. And of course, as I said earlier, dues from members also as ways that we've used to mobilize resources. We also, over the past year, have taken part in some competitive grant applications as a network. One of them, I remember, Musa was part of it. We did some other groups. And so we've been trying to see how, as a network, we can also compete for grants and be able to get some funding to support our activities. We think we haven't been successful, but I think we'll still continue to do that. But just for information, myself and some colleagues, most of you know Diabate from Burkina Faso and Adama from Mali. We actually recently won a grant for Epsilon. Epsilon is epidemic for leadership, something, I forgot what it is. So it's actually supposed to capacity in Africa on pandemic science, okay? So the acronym is Epsilon, and we won one of the grants, and it has a strong component, capacity building component. So many of you, you get some alerts through our network for you to apply, for especially the young ones who want to do masters, PhDs in pandemic science. So that's just for information. We'll provide some further information as we go on. But that's one of the such kind of collaborations are important, so we can all use benefit from. So these are main resource mobilization strategies. But this is a summary of some of the things we've done. I think it's not very long. I've talked about most of them, so I'll not spend my time on this. But just to highlight that we've done quite a lot since the inception of the network. Key to that is the fact that our first meeting was published, and if you check the citations, there are a lot of citations that we received from this publication. And of course, currently we are carrying out a project looking at the population genetics of Aedes aegypti across all the West African countries. And I think Joanna will give more details on that tomorrow, where we are on that project. Last we established partnership with one of the VecNet networks. So VecNet actually is a consortium of networks that CDC is supporting. So it's not only WAASuN. We have about 7 networks spread across the globe, you know, and some of them Pacific, others in South America. So we are one of the network that CDC is supporting. So last year, through CDC and WHO Florence, we established partnership with one of these networks called the Pacific Vector Network. And we had the privilege of having one of them join us last year in Senegal. And the idea was to also get some of us to attend their meetings in the Pacific. Last year, the meeting was in Guam, so on the islands in the Pacific. So that was a very significant milestone because one of our objectives also to establish partnerships and collaborations across networks. So I hope I'm not talking too much. So now we are going to the real discussion on where we have been since last year. Because when we had our meeting in Senegal, we had some things we wanted to do as a way, looking forward to, you know. So we listed a few things, and some of you are familiar with it because we all agreed on this together in Senegal. So I'll just go through them, see some of them that we have been able to do, and others that we are still in the process. So, for instance, yes, please.
I think you ask these people if you are talking much or too much or not. So I want them to just stand up to make sure that they are listening to the way forward. Just make yourself, and then the way forward is very important.
Thank you, Joseph. Thank you for. Yeah, so one thing I didn't also mention in terms of our achievements. Last year, I think I mentioned that in my previous, one of my previous contributions. When we started this network, only actually few countries at the time had any capacity to do surveillance on Aedes. In fact, many countries didn't even have any routine surveillance going in their country at all. But then we try to support countries through efforts from our own, from CDC, because most times CDC will come and provide some basic entomological tools. Many of you are aware, OV traps, you know, all the things that you need sometimes to do surveillance. And also, some of us were part of a WHO WAAHU team. Myself, Malo, and the late Madu, who passed away last year, and a couple of others went around some countries to support, you know, their surveillance capacity, and also do an assessment for WHO to support those countries to start some kind of surveillance. I think we visited your lab in Nigeria. We were in Cabo Verde, Mauritania. I think 7 countries. You know, so. Last year, when we did a survey, at least we had about 80% of the countries in West Africa able to present some kind of data that normally should guide, you know, in terms of entomological data, what should guide risk prediction, basic indices, which is significant. Confess there was nothing at all. So the point I'm making is that we've made some modest gains, modest progress as a network, and I think we should all be very proud of that. So way forward, we decided that at the meeting in Senegal that we'll validate, at the time we were developing an M&E plan, and we had Audrey introduce us to M&E specialist who helped us through developing an M&E plan for the network. So last year we discussed the plan together, if you remember, and we adopted the plan as a network. So that plan is currently in place, and we are supposed to monitor and make sure we implement the activities on that plan. Also, last year there was a vice chair position that was vacant because Mamadou, unfortunately, the late Mamadou passed away. So we had to elect a vice chair, and unanimously, all of you agreed that, please, your name, I forgot your name. Malu. So Malu was asked to be the vice chair of WAASuN. And so thank you, Malu, for agreeing to be the vice chair of WAASuN. And then, of course, we also decided to strengthen all our subcommittees. And I'm happy that just sitting back and looking at all the work being done by the various subcommittees, I think it's very much commendable that we really have made progress, because this is how I think we should go out. Because one person cannot do everything. We need everybody to be on board to support. And all the committees, I really thank you for your commitment to making sure that we, and I know there's so much work to be done, but I'm very confident that we all move to make sure we do our work. So we have a constitution. I didn't put here. We have a constitution for WAASuN. So normally we'll share the constitution before our next meeting. You go through it. If there are any suggestions you have, you can discuss it during our general meeting. Fortunately, this one, I don't know why we didn't share, but we have it. I'll circulate it before tomorrow. If you have any suggestions towards improving or do any changes in the constitution, we'll look at that. And then there was also a discussion that we should also not focus only on surveillance. We should, our name suggests that we are only looking at surveillance, but there was a suggestion that we should also include control. We didn't actually realize that. So what it means is that either we include control in our name or in our, activities. We try to also highlight areas on control. So it's something that we discussed. We haven't really agreed on that. So please think around that. If it's something we wanted to, I will try to include that. We were also to develop a TORs, terms of reference for the executives and focal persons. Has that been done, Joanna? The TORs, we haven't. The TORs for the executives and focal persons. I know there was a discussion around that. No. Okay. So that's also an action point we have to work on. So one other thing we also agreed to do is to enhance advocacy on the threat of arboviruses. That's last year, the predictions were that we're going to have a lot of outbreaks. So how do we, advocate and get authorities to really start supporting surveillance activities in their respective country? We put down some few points. First, we want to organize webinars to educate people on arboviral diseases, at least 2 webinars. How many were we able to do last year? 1? Did we do any at all? Please help me. The second, please help me. 0. Okay, so we put 0 there. We didn't do 1. So we have a lot of work to do. And then also we decided to do a policy brief around the use of ties. You remember that all the presentations coming up showing clearly the role these abandoned lorry ties are playing in some of the outbreaks. And so we decided to put a policy brief. We haven't done that. And also to kind of draft a review on that. Fortunately, I can report that I asked one of my staff to put out a draft, and that has been done. I'll share it with the scientific committee for you to have a look at it, and then we can work on that to have it published, because I've run through it and I think it looks quite good. The other thing is to do the policy brief, which we can discuss and also to organize virtual meetings among members. That was something we were not doing previously. Because previously, once we finish our meeting, the next meeting, before we are actually giving ourselves update. What we decided last year was to have series of virtual meetings, so we update ourselves on some of the things happening, some of the decisions that the executives were intend to take, get your feedback, and so be able to improve. Last year, I think we organized three virtual meetings. I think 2, right? Yes. And that was really for me the way forward, because we got a lot of input from members, and also we had to discuss some of the decisions that we were, as executives, discuss to get your buy-in. And I must say, one of those decisions included the fact that we had a challenge with funding this year. And you remember I mentioned that we're having a challenge with funding, and so we're looking at some innovative ways to be able to have the meeting, and not postpone it to next year. So I tailored some, or put down some suggestions, which included kind of asking all the focal persons to submit abstracts of what they intend to present. So we do a screening of those abstracts, and then we pick or select people based on those abstracts. Fortunately, many of the focal persons sent abstracts, others did not. We actually gave the deadline, we postponed or changed the deadline, still others did not submit. So we went ahead and did the selection, and then sent the information around. And all this was discussed during these meetings. But I'm very sad to say that, unfortunately, some of the members didn't understand what was going on. And one of them wrote to me and accusing me of bias, and saying that they were favoring some countries and other countries. So it was a very bad letter. And initially, I didn't want to respond, but I tried to respond and explain things to him that this will actually happen. Even for the pre-workshop participants, we had no role to play in the selection. It was purely done if, I think Paloma is here, all the abstracts were sent directly to WHO, and they had an international panel that did selection. We only received the list. So we had nothing to do with the selection. I just wanted to bring this up, but I don't know how many people have had this information that, the executives were biased, and no, nothing at all. And interesting enough, all the years that have passed, we've tried to bring everybody here. Is that not correct? Yes, almost every focal person will get you to the meeting. But this year, we had a challenge, and we had to do something about it. So please, when we discuss these things, it's not for any reason. We all want to make sure that we have a network that is vibrant, and we can continue to contribute to our continent. So that is something I want to bring to talk to you about. We, as executives, to make sure that the network grows. Any concern or any idea to improve, speak to us, and then so the other thing I took discuss was publishing our meetings, because the first publication we did was the meeting we had in Sierra Leone. So we decided that our the meeting that we've had in Côte d'Ivoire, Cabo Verde and Senegal, we're putting. So that is being done by the team, and hopefully next meeting, during our virtual meeting, we'll discuss that. So still on the way forward, we to also develop a communication strategy for WAASuN. So Daniel and the team, Andy, have worked very hard to. Sorry. Sorry. Okay, so please, 1 minute. perfect. It's your laptop. Really? Oh, then that's good. I thought it was. Oh, if it's yours, I'm not worried at all. Okay, thank you. This. Okay, sorry about that. This is a hazard which we had to deal with. No, I think the thing has moved. Yeah, the slide has moved. Up, yeah, go up. No, forward. Here, yes, we are here. Yes, so again, sorry for the, So currently we are working on our website, and Andy will report on that. We have really improved our website. How many of you have been to our website? Can I see by hand? Recently? 2, 3, 4. Oh, only 4 people. Lara, 5. Yes, please. Let's go and have a look at our website. We need suggestions from you. Okay, just go look at how we can improve. We've actually changed the guy who was hosting the website. We've actually got a new person, very professional guy, and it's made the website very interactive. And Andy will take you through that when he gives his update. So the website currently looks very good, but still needs improvement. And hopefully, so I've talked about this, about incorporating control in our TORs, enhanced partnership and collaborations. And that's why this year we also have established partnership with Global Biodiversity Information Facility through Paloma and the team from TDR. So we'll continue to look for opportunities for partnerships. Also update the platform with new members. So if you go to our website, we have created a membership, interface where you can actually just put in your details, and then we can, get your name on the list as a member. So please go on the website and then try to, if you are not a member yet, register to be a member of WAASuN. So some of the things have already been discussed through the various subcommittees, establishing standard working guidelines for countries and all that. Those are things we've discussed previously. We've also talked about the subcommittees. So we are aware about the subcommittees and the work they are doing. So in terms of the way forward for 2026, and this is the critical part I want your views on. So you remember in Côte d'Ivoire, we did review the constitution and especially in regards to the officers or executives of the network. So we agreed that all the executives will have a 4-year term, and then after that there will be elections for new officers, and the executives are eligible to what? Reapply, right? Okay. So the point I'm making is that next year we are going to have, during our meeting, we elect new executives in 2026. That will be 4 years after we actually agreed on that. So if that's agreeable, I just wanted to take note of that so that next year you know that we'll have new executives to steer the affairs of WAASuN. And then the other important thing is next year to discuss issue about where we are going next year as a network. So our meeting next year, I've had a discussion among different category of members. As executives, we have met to discuss, and we are making a proposal for our next year meeting. Looking at the funding, the landscape, and the fact that we are not too sure of having funding to continue the way we have been doing over the years, we decided that instead of having kind of a meeting of our members, we have what we call a regional conference. So a regional conference So still under discussion on arboviruses, and then try to open it up for people to submit abstracts, and the abstracts will be reviewed, and just like having a normal conference. So this time we open it up for other people to come in and then present their work, and as members we also expand our base in terms of membership. Through that we can raise some funds to be able to, so for instance, if you have $5,000 to go to ASTMH in November, please keep it in your drawer and know that next year you use part of it to come to WAASuN. So start planning towards that. Of course, once we get funding from other sources, we can also support, especially those who really will be in need to attend those meetings. And we also are proposing to have a training workshop on insecticide resistance for a reason, because from discussions, if you can get some funding at all, the focus for the use of that money should be on insecticide resistance. So we are still discussing the details of that, how we want. So I just brought this up. There was also during this meeting, I hear the proposal to have a training workshop on metagenomics, if I got it right. So I just put it there, or some of the things that I think we want to do next year. And then I listed a couple of countries that probably we may have this meeting. Of course, subject to your own voting. Next year, we should be able to have a country where we can have this conference going forward. So I listed a couple of countries. I didn't include Benin. Where's Ange? Oh, I'm dead. Is Ange here? Yes, I think I omitted Benin. Yes, so Cabo Verde. Where? Niger. Okay, I didn't. Okay, good. So thank you for noting that. So Niger, Benin, Cabo Verde, Togo, Mali, Nigeria, Burkina, Gambia, Guinea-Bissau, Mauritania, and these are countries where we've not had any meeting, or not really had a meeting. So I just listed them. Please think around. We'll vote on these countries tomorrow. Huh? You want us to vote now? Yeah. No. I intentionally was very deliberate because, excuse me, can we? I was deliberate on listing because I listed countries where we've never had a meeting. At least apart from, I think, Cape Verde and Cape Verde. Okay. So, for instance, Senegal. We were in Senegal last year. We were in Cote d'Ivoire, 2 years ago. And of course, we are in Ghana now. So those countries were countries I thought we haven't had any. But of course, I include Benin as well, and then Niger. So I don't know whether we'll postpone the voting to tomorrow before we close. Is that okay? So that you cannot think around that. So that at the end of... You are going for campaign, eh? Okay. So by tomorrow, when we are leaving tomorrow, we should have a clear idea where we want to have our meeting. Because it's a democracy. Democracy is the way to go. So we'll try to do that. So I want to first acknowledge all the WAASuN members. In fact, you have very... Excuse me. Can we all have one meeting, please? 1 minute. This is important because I want to acknowledge everybody here. I cannot but thank you enough for all the hard work that you put in to make sure. When we started, we were only about how many? Few people. Now we have numbers that we even have to control, especially when we're having our meetings. So I think we are doing something good, and we must all congratulate ourselves for the commitment that you've shown over the years. Many of you are very busy people, but you always show commitment to WAASuN activities. Of course, our main founder, unfortunately, Dr. Audrey Lenhart, who is not here with us for the first time. We say a big thanks to her for her support over the years. Florence has been very supportive. We wish she was here with us, but she couldn't make the trip. And WHO TDR for their help over the years. you know, GBIF, GBIF, is that the way? How do you pronounce it? GBIF. Oh, okay, GBIF, right. So yes, this year we actually hosted a meeting with, together with Global Biodiversity Information Facility. Of course, WAAHU, we've worked with them over, last year they supported us in training our members. School of Public Health, University of Ghana, where some of our funds, are channeled through before we get the funds from CDC. So I want to acknowledge them. Our Ghana Health Service have also been supportive. Noguchi, where we have they've hosted us actually over since the inception of the network. So the director was here yesterday, and we are very grateful to Noguchi for. We are making arrangement for a trip to Noguchi tomorrow. So we'll give you updates on that. And of course, the recent partnership we had with Pacific Vector Network. So we have a QR code. So if you want to be a member, if you scan the code, you get something on your phone, and then you can enter details. Of course, contact information if you want to any of the activities. So by way of our activities as a network, I think that's where we are. If I've left out anything, the executives and anybody can draw my attention, and then we can. But so it's a discussion section. If you have any ideas on all the things that we've talked about, please feel free to bring them up, and then we can all agree. So from here, we go to pick all your suggestions and have a way forward for next year, so that tomorrow before we leave, we'll project what we intend doing next year, especially based on some of the key things that we have listed. So thank you all very much, and we appreciate all of you. Thank you.
Thank you so much, Prof. Comment, question? I have one before maybe the panel. Is about the replacement or the change on for next year. I don't know what is the plan. Sorry, I've not read carefully the Constitution. Are we open, like a call for candidates for somehow like that? Are we setting up a group to lead that, to make sure that, as you said, people are saying sometimes the executives are biased, to make it like, okay, we have maybe select maybe 4 or 5 people, we collect candidates, and then we try before the next meeting to get the list of the candidates on any of the posts and some. I don't know, just an idea.
Previously, what we did was to ask people to put in names during our meeting in Cote d'Ivoire. So we put a position, and then you ask people to or suggest names, and then we vote at the meeting. So I don't know whether we'll need a group to do fact finding. I don't think so. In my view, I think once you are very clear that you want to, stand for that position, when we advertise it, you bring your name up, and then we vote. That's my view. Any suggestion on that? What do you all think? Malu, I want to hear from you. What do you think from the Joseph suggestion about setting up a committee or electoral something? I don't think we are a small group to do that. Okay. I think, in my view, like we did in Cote d'Ivoire, okay. We put out the positions, people bring their names, and then we vote. And by the time we are leaving, we have a clear idea. Yes, then
that's fine.
I think that should be very clear. Okay. So please start preparing your mind and lacing your boots to take up the mantle of leadership next year.
Yeah, I was just wondering if we would rather not wait till next year to vote. I was thinking we could do it maybe in 6 months' time, so that the incoming executives would have time to shadow us. The present executive will still be executives, but at least we know the people who are going to be the next executives, and they will have enough time to learn or pass on everything that we need to pass on before. I think waiting till the end of the 4th year to do the election may be a bit Because at the fourth year, people will just be in a hurry to leave and probably won't be apathetic, like won't mind anymore. And then the new ones will be struggling to keep up with everything. So maybe we should have a bit of time so that the new executives can shadow us.
So that's a suggestion. Any view from that, please? So we are having suggestions. Any view?
Okay, thank you very much. I must commend Professor Zaze and his team for doing a good job. I am a bit worried that there are signs of cracks in the same organization that is not bigger than this for now, especially against the background that the chairman had to be accused of being biased. I think these are telltale signs that among us we have some people who might be drawing the hands of the clock backwards. And I want to suggest, based on my experience and involvement in networks like this, that I've had to fold up within a short time. African Biological Safety Association is one of such experiences that I've had, that have also taken me to Ghana many times. I'd like to therefore suggest that the leadership should, like Professor Daze said, should be able to come out clean on all activities, especially as build up to our meetings like this. You ask the question if there is anyone who have heard of some kind of bias. And I can say that, yes, I had that when I got here. You recall that I was here on Sunday. And in my first 2 days, I think such things were brought to right before my face. And I was not happy with that because I had seen the team as doing some very great job, which I have acknowledged at different opportunities. Because I know what it takes to put associations like this together and bring up activities that will lead to progress. I will want to therefore appeal to those coming up with the discordant tunes that they need to actually shift their sword, because the days are quite early in the formation of such an organization like this. Even though I've had such experiences with some networks, and as an entomologist of more than 30 years practice, as a professor of applied and medical entomology, I have not seen, I do not belong to such network as this in the whole of Africa. So I think therefore that this is very unique, and we must do everything possible to make it float and not sink. So the second thing I like to say is about the election. And I think as noble as the thoughts are, and especially to avert some thoughts of some people wanting to sit tight in office, I think it is important that we put the TORs and other missing gaps in the Constitution together, and then we have an election. It's good, perhaps, if we have noted that some people who are serving on the team can also to be returned again. But I think it is good that if you have our compass together in the form of the Constitution that will guide our operations before we now go into such election. The question is, how long will that take? I don't know. But I rely on the leadership to let us know if we can actually dot the I's and cross the T's about the Constitution between now and the next year that we are going to come together and talk about election. If it is so, then it's good. But if it is not so, I do not think there's a need to hurry, because that it will be no point changing a winning horse, or should I say a winning team. Thank you very much.
Thank you. Thank you, Professor. Yes, all your views well noted. The issue about the Constitution, we actually have a Constitution. 2 years ago, we did review it. So there's actually a Constitution. There's not the other thing we have to do on is the TOR, as you rightly said, and try to see how. And please, I'll share the Constitution with everybody. So if you think there's some suggestions, please don't feel free to contact us, and then we can work on that. So all your points are well taken. Thank you for that. Yes.
Thank you, President. I want also to maybe to highlight one topic or two topics, if we can together discuss. Election is important. So if we have no money to continue to work, it will be difficult for us. So I'm proposing just to brainstorm about how really we can raise a fund for WAASuN, because it's very important. Yes, we started B2B discussing about how, for example, we collect fund. One of idea is, for example, if we can approach some manufacturer, we have some product to test. Sometimes they contact if we propose our network to different manufacturers, it says that we, for example, can interact with them and test their products. We can maybe get some funds to put in WAASuN. And WAASuN, for example, can select different center with skill, for example, to test the product, and give them some fund to test the products. And probably, usually in our institution, we have what we call overhead. Maybe this overhead can be part of the WAASuN profits. Yeah, this is kind of idea we need really to discuss. Yeah. Another is we know now this last year USAID, CDC, we get a problem because if we stop cut some funds, and many institutions suffer now because there are no money to do activities. How locally we can really get the fund or means to work, to continue to working. We need also to discuss about that. This is the two topics I think that is very important for us.
Thank you, Musa. I think those are very good points. I think one of the ways we can also enhance that is to put some of this information on our website, what the various countries or institutions are capable of doing. So for instance, if you have experimental hats in your institution, and we have in Oduka, we can advertise all this on our website. So if anybody is looking for partners to do a kind of trial, WAASuN will be an option. You get what I mean? So we need to really showcase what we can do, and then people, so I agree, sometimes many people approach me to do some testing and they want a multi-country trial. So I think this, I think we can look at to try and get some funding, you know. So I agree with you on that. Yeah. Any other comment, please? Lara? Please, these are interactive, so feel free to bring out any ideas, because this is the future of WAASuN. And this is the discussing the future of WAASuN. So bring all the suggestions. We need
Yeah.
your.
It's only to reinforce, like we was speaking this morning about the idea to have some standard content looking for grant. I think we have to go in another level or in two level, a local level but a big level, because we are not using the power of, we are 19 countries with a lot of problems and outbreaks, so we can create this document in behalf of all the country and looking for money. I think that could really help. At local level, we need to enter more near the government of all these countries. So this policy brief to introduce WAASuN inside the government of all the countries could be interesting. And I think we have to do more really operative the next work with project sharing between all the countries, almost all the countries. We have this of the eggs, but we have not any other project. So perhaps we can think in one or two possibilities. The scientific committee can help with the draft, and after now we have committees, no? So the other subcommittee for financing go to looking for the money or something like this. Be more operative between all the countries, all the networks.
Okay, thank you, Lara. So still the point of resource mobilization and making ourselves visible to get funding. Yes, any suggestion on funding, on leadership, anything that you think suggestion you have to improve the network? Because from after today, tomorrow we'll be looking at the way forward. So if you have any suggestion, please share it with us, and then we can add it. Or else I'll be calling people to speak. If you don't want to speak.
WAASuN note, share our data, the open data, something was here now. All the people that and
Right, thank you very much. So once I'm not getting feedback, I'm going to go. I'll try the funding members. You should be speaking. Lucien, I want to hear from you. What's your suggestion? Yes, Eva, before Lucien speaks. Eva, if you can. Now I have to come to you to speak.
I was wondering if you had considered vendor sponsorship. Is that something you have thought about, such as you recommend using BG Sentinel traps for the surveillance? I know certainly the BG, the Biogens, they help pay things for the AMCA conference, American Mosquito Control Conference. So, and then also, maybe I know someone from Valent Biosciences is here attending this meeting. So maybe that could be an avenue, is having some vendor sponsorship.
Right.
And it could actually, if they had the opportunity to show some of their products, it could actually be an opportunity to learn more about things that are available through vendors. Just a thought.
Thank you. And you will agree with me that that's why I added Eva to the Resource Mobilization Committee. Thank you, Eva, for that suggestion. Any other comments? Lucien, do you have anything? Yes, Malu. And when I finish, I'll come to Odoka. Odoka, get ready.
Proactive. And for me, in terms of funding, there is It's two aspects. The first is funding WAASuN functioning, and the other one is funding, the activities as part, for instance, what we did with the scientific committee. These are two aspects that are complementary. For instance, when we, when we designed the proposal with all these activities, if we get a funding, I think we can put something like, how to share data, how to, to organize, some type of meeting, just maybe to talk about the result with the finding we obtain it through, the project we're gonna have concerning each aspect. And this type of money could go through WAASuN functioning. The other things for WAASuN, specifically the functioning of WAASuN, what I would suggest is maybe to work more on sponsoring. And I think this is really lacking. I like the idea maybe to work with bioscience, to work with biogen, but also to have some more sponsoring. Also to knock the door of funding agency, because for me we need really to be in contact with these people. I don't know what Gates Foundation will do about this type of networks, but since we don't know, we have to talk to them. We have really to propose to them, to show to them what we are really doing, because they are funding a lot of money in surveillance, mainly human surveillance, nothing for mosquito surveillance. Why not? But maybe because they don't know who we are, and I think we should do something like that. When it's come to WAHO, I like the idea, and I appreciate really what they did last year. But for me, it's not enough. We are talking about WAASuN, which is, a network for ECOWAS. For me, WAHO is the branch, the health branch of ECOWAS. And for me, I think they should really have some fund dedicated to this type of network, because this is their work. But I think we did not have enough connection with them, and to try to have something sustainable, not only support as part of meeting or things like that. But at another level, really AU, African Union, what they are doing actually concerning that. There is PAMCA for sure, maybe they are doing something for them, Africa CDC, but this is type of network that could be also supported by NEPAD or AU. I think these are some doors that we should really knock, explain deeply what we are doing. We could be successful, they could reject it, but we should really try. Thanks.
Thank you. Hello. I think these are very useful comments, and I think I've even had some engagement with Musa on this same issue of AU, and also some of these funding agencies. And also, I think this will be the right time for us to start talking to, because dengue is a major issue now, even at a global level. At a global level, WHO, everywhere, people are really, I serve as the vice chair of the Global Aedes-Borne Initiative, and I know a lot of our meetings, there's a lot of interest in West Africa. I think we need to take advantage of that and try to get support for our network. We are doing very fantastic work. We need to make ourselves visible, and so I agree with you perfectly on that. Any other suggestion, please? Any comments? Please, are we taking notes? Somebody's taking notes? Oh, okay, thank you.
Chair, you mandated me.
Yes, I want you to speak.
I just noted the Global Aedes-Borne Initiative as you spoke, and thank God I didn't even know you are the vice chair. I remember all the runarounds, contributions we made when it was going on. And I think our emphasis on multi-country studies that we should follow through. I think the one we have already is dragging. If we should have multi-country studies with the status of WAASuN kind of overseeing that, something like what we were discussing earlier, have a group, have a call, discuss it across board, like we are discussing these issues of tires now. We can either go with published studies on that, and as a kind of review, bring out the facts in it and present it at the sub-region. And that makes a whole lot of sense, even if we're not going to newer studies. However, other forms of multi-country studies, where we have to come together and replicate what we have in one country or the other, which defines a whole lot of what is happening in the West African sub-region, like the waves of, you just showed about 6 million cases where we had dengue, cutting almost across the entire sub-region. So such issues brings WAASuN to limelight and then becomes a foundation on which requests for funding for other studies can hinge on. So that's exactly what I'm looking at. But there must be emphasis, and then we must have speed attached to that. Like the issue of the surveillance we are doing with respect to the eggs. By now, assuming it's published, and then we can be making references to that and something showing the entire sub-region, and that is quite huge. Thank you very much.
Thank you, Luca. I think for the egg survey, I think Dr. Joanna will speak about that later. I think tomorrow, yes. So we'll all make our contributions. And I think I've seen the data, and they are getting very good data from countries. Do you have time? How much time do you have?
I think after this, so
okay.
When you stop, and then
no, I think Andy is presenting. There are two presentations, I think. Yeah, Paloma was also scared. Yeah, so on that note, I want to thank all of you again for your contributions, and
okay, so be focused. So like 10 minutes for Andy to give us a kind of update on the website. I think Prof. just talk about that right now. And then we have few people actually going, like visiting the website. After this, I think we all go there.
Hello, good afternoon, everyone. Oh, please, are we here? Good afternoon. Bonsoir. Bon dia. Bon tarde. Okay, I missed the Portuguese. So on the back of what Prof just did, I hope I'm not boring. Let's quickly run through the website. I have a few updates for all of us. So quickly, a brief overview of what I'm presenting is, we'll look at the update on our communication efforts, the website itself, some gaps and challenges, and then recommendations. So for WAASuN, our main communication channel has been internally through WhatsApp, emails, Zoom, and Teams. And then externally, our website has been our microscope to the rest of the world. And social media as well. Prof mentioned this briefly. We've intended sending out newsletters and having webinars. They've just been in the plans. We've not been able to do that yet. So on our website, we launched a new one quite recently. We had previous issues with the past one. It was very static. There was no interaction. You get there, it was a bit boring. So we've updated the website. We have a very new platform for those who have never been there. And the structure is as you see here. So there's a that tells our mission, visions, a couple of ads on our current activities that are going on. We have an About Us page that talks about who we are, the various executives of WAASuN, member countries. We have an activities page that shows WAASuN projects and another prospective project, putting our publications on. So at meetings, we ask for publications from WAASuN members. A good number of us send them through the different, sharing them as links or as that people can load and use readily. Now we've made some headway. So after this meeting, we are hoping to have publications from everyone. We want to put all our members out there so that the visibility is quite high. We can really relate to members easily. And then we have a page for our conferences that highlights past conferences and other trainings or events that WAASuN has had in the past couple of years. And there's the Get Involved, which is the membership or enrollment tab, which you just tap on and you can enroll as a WAASuN member directly. We also have a Contact Us page where there's easy access to WAASuN through that tab. You tap on that tab, it takes you to our emails and other socials very easily. And then there's where we have a lot of information on opportunities, PhDs, any other opening that we have. We put it there on the Get Informed page. Then there's, of course, the Downloads tab that helps you download files, PDFs, publications of members. And our new site is powered by Code Ghana, a private budding internet company. So a few strengths of our current website include it has a very clear mission, and we have very consistent branding. It looks a bit more interactive now and quite a captivating interface. There's contact information there that leads you directly to WAASuN if you have to send any message across. We've also integrated payment platforms where if you want to pay dues now, you can click on the website and make payments directly. You don't have to come and see Selassie in Ghana before you can pay. Do I repeat that? Yes, you don't have to come to Ghana before you can pay. So from wherever you are across the world, from anywhere, you can pay directly on the website. And of course, with the payment platform comes added threats of hacking. People are interested in the monies on there. So we've also improved on our security very much. We've bought firewalls across, and then it's a bit more difficult to hack into the system than it was previously. So a few of our gaps and challenges, as I've highlighted here, are very low stakeholder utilization. So like Prof asked, only 4 people out of all the people in this room have been to the website. It's very sad. Vice President, hello, Zamalu. I know, exactly. Joseph, yourself, you've not been there. Never. Okay, so there's very low utilization of the website. The more you have eyes on it, the more it helps improve the website, because there's something we call SEOs, search engine optimization. The more you go there, then the site pops up when you type in something like Aedes-Borne, for instance. And we seem to be doing quite well, because when you type in something like Aedes-Borne, we come up at 4th. And that's not so bad, considering WHO comes before us, NIH, and then CDC, which are very big anyway. But at least we are doing better than, thankfully Pacific is not here, we are doing better than Pacific and other networks. So let's keep it up and let's help improve it better. There's also a poor mobile mobilization, optimization, where our mobile interface is not as good as the website one. So we are trying to improve on that as well, so that from wherever you are across the world on your smartphone, you can easily access the site and all the other things on there. And going forward, there's also no multilingual support. So since our target group is not just members of this network who are very fluent in English across board, We want to be able to have other languages on there where people from Cape Verde, Angola can see Portuguese if they want to. People from other French francophone countries can also see French if they want to. So for some feedback that we've got so far, the website, people are saying from the comments we have that it's very useful for knowledge sharing. They've asked for the need for us to have easier content contribution. And there's been suggestions for us to have a dashboard, for instance, which I'll show in a bit, and a blog and newsfeed, like I mentioned. So our dashboard would capture these analytics on the page. So monthly visits, for instance, most visited pages on the site, because there are different pages. So we want to know what it really interests people on the page. Is it the publications, so that we improve on those further? Session durations, how much time are people spending when they visit the site? Bounce rate, visitors geography. Is it only West Africans who are looking at our website? Do we have eyes from all over the world? And then even the device types. Is it more mobile than MacBook or PC based? Those analytics will be shown probably at our next update. So our few recommendations are, in the short term, we want to have very regular updates, because the more you update, the more it becomes interactive, interesting for people to read. We want to improve our search engine optimization and the mobile layout. Going forward, we want to have a data dashboard that gives us all the analytics without necessarily going to a third party to get that information. We want to put all our publications on there. This is a very strong call. We need them. The more we populate the site, the more engaging it will be. So let's please bring out all our publications. You just send them as links or just as titles, and we'll be good and happy to download them and put them on the page. And we also want to include member profiles. So there are focal persons for each country. We have all the countries on the site, but we don't have your profiles as individuals. And that's what Prof mentioned. So for instance, in your profile, if you have an experimental hat where people can do a study, you can put it down in your profile as well, your capabilities, your strengths and competencies, so that we can market you as well on the website. And then in the long term, we want to integrate AI for a lot of the things we do, so that we can be able to have the multilingual functions where you can get on there and see any language at all that you want. So our contacts are here. So hopefully after this meeting, please let's all do well to visit these sites. Those of us with social media handles, please follow our pages. The followership is quite low, and it makes our visibility low as well. So everybody in here, right after this meeting, let's try and follow. So our email address is info@waasun.org. The website is www.waasun.org. Our socials are Twitter or X, WAASuN, @WAASuN. Our Facebook is WAASuN, spelled fully, not with the abbreviation. It wouldn't fit in my slide. So West African Aedes Surveillance Network. And then our LinkedIn page is also West African Aedes Surveillance Network. So I don't have a chair for my session, but I'll do something that is a bit unusual. So instead of my Q&A being you asking me questions, I want to ask you these two questions. And I want to solicit responses from you, so that by the end of our meeting, I'll send out a survey and get those responses to help improve our website. What improvements would you like to see on the website? Unfortunately, most of you have not visited the website, so you can't even propose improvements. So after this meeting, let's all make it a point to visit the website and pen down our improvements we'd like to see, and how can communications better support members. Any ideas would be very, very useful. So thank you very much. That's the end of my presentation.
Me, I'm chairing the session. You say you don't have chair. How come? Okay. We have a few questions for you. You have one, right? Okay, I have one, but mine may be a comment.
Thank you very much. It's not a question, it's a contribution. So I looked at the social media handles, and it looks like we need to add on. I went to a recent meeting, and even before that, most people have left Twitter. They've left X, yes, for reasons. I mean, you need to think about it. They have left. So they are now on Blue Sky, they call it. So most people who did the presentation at the meeting I went to never showed Twitter or X as a handle. Okay. It's always Blue Sky. So I think we need to go there and put ourselves in there. Otherwise, the international body will never see us, probably.
Okay, thank you. So that's our first suggestion. Well taken, noted down. We'll do that immediately.
Okay, mine is a comment. I think I don't you listened to Prof very well when he was explaining what we did and what we are doing and what our dues were doing. And as he was saying, our dues was part of this payment. So if you are not using it, you are spoiling your money. So that's why Andy said that go there, because whenever you go there, you are enjoying your dues. You see what I mean? So go there. You see, and then you know that, okay, you gave money to Sila, you are taking $1 from going to the site. You take $1 off by going to the site every day. You can use it for 365 days, 365 days, and then you, on the next meeting, you know that you pay your dues, you enjoy your dues. So go there. Lara, okay.
Thank you. Yeah, thank you for the proving of the web, the page. I imagine like it's now have to be refilled, no? Like you said, like the information could be to give more visibility of the local activities the people is doing related with WAASuN. For example, I remember in November 4040, the last year, 4044, the University Jean Piaget give a campaign because we are with the dengue epidemic, and we do integrated WAASuN. We put WAASuN in all the communication, and we invited Jewelna to speak in our conference. We have a cleaning campaign with the population first in the morning, and after we do some conference. For example, that is a local activity where WAASuN participate. I'm sure there is other in each country, so perhaps you can integrate to have more visibility what is doing all the countries of the WAASuN.
Okay, thank you, Lara. So that shows the strong commitment you have towards WAASuN, and we are super proud of you for that. Like you're saying, when we have local activities like our Malaria Day celebrations and stuff, we can put WAASuN on there, just showcase it, because those are also platforms where we can sell the network and vice versa. So like we mentioned previously, we are also supposed to hold our webinars and other visibility campaigns to make us more visible across. So we would also not renege on our efforts. We'll try as much as possible to meet you halfway and help grow the network. Thank you, Prof.
Okay, thank you. I'm amazed that you said that if you have to make payments through the website, it's just one click. Because I don't think you can say that again with confidence. And the reason is that as recently as I was about to come to Ghana, an attempt was made on that, and it didn't fly. Even while I was there 2 days ago, it still did not fly. And so I think if the right things have been done on the website, perhaps you need to also make sure you connect with your payment gateway. It may not just be what it seemed to have been. Thank you.
All right, thank you, Prof. So that's very good feedback. Sometimes we don't get this feedback, so we might not know what exactly is going on. So we'll follow up on that and help try to resolve it as soon as possible. Are we done?
No, I don't know why Prof had to say what he just said now. I'm telling you, Prof, you have just said something that has touched me deep down. Because I wanted to ask Andy, so should I go and get my money from Selassie and try to pay through the website? And now Prof has said something that I don't understand. Maybe I need to leave that, isn't it?
No, I think we've tried it.
Yeah.
You know, there are certain platforms that will not allow certain payments with certain cards.
Okay.
So we probably have to look at that. I'm scared of answering
that question. And one more question I have for you, Andy. Am I going to pay for marketing me on the website?
For you being marketing?
Calm down, Abba.
Let me get it.
Andy.
If I put you on the website.
I don't understand.
No, wait. If I put you on the website, are you going to pay?
Yes, because
you're a member. You're a member. It's a benefit of you being on the platform.
She wants from me.
Okay, let him ask again in Ghanaian language.
Websites.
If he is rather marketing. Thank you. Thank you. All right, I think Stella.
Okay, good afternoon once again. Good afternoon. So this brief presentation is going to give you an update of our financial status as a group. So looking at the total amount of money collected in Senegal, that's in year 2004. For our dues, we collected an amount of 4,300 USD. So after this collection, let's go to the expenditure in Senegal. So for our meeting in Senegal, we paid 500 USD to the bereaved family, that's Mamadou's family. And the total amounts that I finally deposited at the bank after paying this money to the family was 3,800 USD. And before depositing this 3,800 USD, I had in our account we had 3,307.15 USD. So in all, after depositing the 3,800 in the bank, I had a total of 7,107.15 USD. So after depositing this money, or after having this money in our accounts, we made some expenses. That's after the Senegal meeting. So for July 2004 to June 2005, the expenditure that we made. So we paid for the maintenance of our WAASuN website, just as Andy said. That's 800 USD. And then also we made some payment, DHL payments, the eggs that you brought, you sent to Ghana via DHL. So for Mali and then Niger, we had to pay using our dollar account. Sorry. So for Mali and Niger, that's 2,075. It's Ghana cedi, but I had to use the USD account to pay. And then for Burkina Faso also, we had to use the USD account to pay. So after doing all these payments, currently in our account, that's as at June 27 June 2005, we have 6,120.39 USD in our account. So that's the money we have in our bank currently. In the bank currently, 6,120.39 USD. So we also have a CD account, and that's even almost depleted. So we also made some DHL payments with our CD account. That's for Cape Verde, we had to pay 750 from the account, and then also for Burkina, we paid 1,543 from our Ghana CD account. So as at now, the money we have in our CD account is 209.58 Ghana CD. So that's something brief on our finances. I don't know if you have any questions for me. Thank you. So I'm still collecting for this year. So you can make your payments to me. No questions, then we can move on to the next next on the agenda. Sabi.
Okay, I think this is the last session of this afternoon. So, are we together? Are we still strong? Because it's really important. We are talking about collaboration. This is part of the collaboration that we are working on, and Prof already mentioned it. So, for those who were in the training, I think they have a bit of context of this. For the newcomers that they just joined the group on Wednesday, so Paloma is going to take you through this collaboration. And while she is talking, I would like us to continue praying so that what she said earlier will change. Okay, over to you, Paloma.
Thank you. Is it working? Can you hear me? Okay, good. I'll be very brief. I know we are all tired, but I guess it's a nice opportunity to talk to those of you who weren't here on Monday and Tuesday, because you probably heard a few times about GBIF and you're wondering what is GBIF. So I'm going to present you a little bit of GBIF or GBIF. So in the context of vector-borne diseases. So GBIF is the Global Biodiversity Information Facility, and GBIF has been working as an international network, so it's a network of countries that participate and fund an infrastructure diversity available and free for everyone. So, guess we move. The vision is a world in which the best biodiversity data underpins research, policy, and decisions, and has a mission to mainly mobilize data, but also skills. So it is also very, is a strong part of building, and to make biodiversity data freely available for everyone so we can make better decisions. So I guess it has to do a lot to do with what all of you are doing here also, promoting the network to use all this data you're collecting to, prevent more of these arbovirus to be spread. And so these are some numbers. So GBIF today is the largest biodiversity repository that it exists. It has over 3 billion records on organisms. It's got some more than 140,000 data sets published, and is being cited by more than 13,000 peer-reviewed papers, in peer-reviewed papers. And what else? It has an average of more than 2 billion records downloaded per month. So you can imagine it's a huge, it requires a huge IT infrastructure to, allow all this traffic of data daily. So in order to be part of GBIF, a country has to sign a memorandum of understanding with GBIF. So this is done usually at ministry level. So in most countries, is either the Ministry of Environment or Science and Technology, but it depends on the kind of importance of the subjects to each country. So for example, Canada has signed the memorandum with GBIF through the Ministry of Agriculture. But we all know that Canada is a very place, and food security is something important to them. So the Ministry of Agriculture thought that it was actually their job to secure, biodiversity in the country. So then GBIF has a structure of a governing board, which is made of representatives from all these countries that are part of the network, and they are actually the ones who make the decision on how the budget is going to be spent. So every year they gather and they decide, like, I don't know, some 5-6 years ago, they decided that health and vector-borne diseases were going to be a thematic priority. Which is voted. And since then, GBIF has been committed to promote more mobilization on data on vectors. So this is the network of publishing institutions. It's not the network of participating countries. So some of the countries, they are publishers, but they don't actually make part of the network, which is the case of China and Russia. So they publish a lot, they use a lot of data, but they are not members. And I'll go quickly through this because I want to show you something else. The thing about data is not, today we know that it's not only important to make it open, but it's important that it's under the FAIR principles, which means that the data has to be findable, has to be accessible, interoperable, and reusable. So it means that we need to find the data. Once we click on a link or we search on the internet, we need to find it. The link has to work, and ideally has to be using data standards, so everyone can use the data very easily without a lot of manual transformation, and reusable by having a clear license that is attributed to it, which let us know how we can use inside the data. So the benefits, why would I make my data open? There is a lot of benefits, especially, and this is something I've been telling you, that it's really nice on our specific case, is that we can provide a lot of recognition to the people who gathered the data, who collected the data in the field. And we also become more aware of how to produce good quality data. Again, it goes to a bit to what you were discussing, the science committee and the vector control committee, subcommittee, that we need to standardize a lot of practices, and standardizing how we collect the data, especially from the field, makes life much easier in the kind of next stages of our research. There's increased visibility. We contribute to the global knowledge of biodiversity. Through visibility, we enhance the possibilities of collaboration. And one nice thing that GBIF does is to track the use of data. So every time someone uses our data, we can actually see who and why people are using it. So this is a bit of the infrastructure. I guess I'll go through this very quickly. GBIF, which is data from, let's see, with dates and coordinates, but also checklists, which are just lists of names, and metadata. Metadata data sets are usually for big biological collections which have not digitized everything, but they want to say, look, we've got all these things in our collection. And finally, sampling events data. It's most of the data we produce because it's data from systematic collection in the field. Date, coordinates, and a clear sample call. So I guess I'll pass all this. So this is what the data set looks like when published in GBIF. We can see that it's possible to, we clearly see the affiliation, the authorship. There is a DOI that gets assigned to the data set once it's published. And the data citations of this DOI are also tracked by GBIF. So if we click there, we can see the papers that have used the data we produced. So as I said, since 2019, 2020, GBIF has been more focused on increasing vector data content. And it created a task group of experts. So if you visit the page at some point, you will see be a lot of people you know that are part of this task group. And one of them is Florence Fouquet. So I guess we're missing her a lot here. And Florence has been really in promoting open data in GB vector community. So through her support and the TDR support we are on the third call for data papers now that are being published in a special gigabytes. And we had a training in Thailand in 2023, having the training here. So this is all thanks to her efforts and the TDR sponsorship. Those who are not here, the workshop we had this week had the objectives of trying to explain the importance of data sharing and to learn a bit about data standards, data quality, data cleaning, and how to publish this in a data set in GBIF. And also Tsiki, my colleague from the Africa support team from GBIF is there. And we're here to also help, you know, if you want to talk to us or are interested. And I'll skip this because I want to show you the kind of live thing. One feature that you might be interested in the context of WAASuN is the GBIF has some nice things on the website. So this is the portal. So again, I invite you to visit, but if you scroll down, there is a map of all the occurrences in GBIF at the moment. And this is something very interesting because a lot of people working with biodiversity, they really recognize this. This is not a map of biodiversity, right? Can you see? This is a map of money. So look who has more occurrences. And a lot of these occurrences are actually from our countries, right? So I guess one thing we're trying to do is reverse this. So I'm Brazilian, so in Brazil and our neighboring countries, especially Colombia, they are doing big efforts to improve the number of records that are available for everyone. And as you can see, there are not much data from Africa. So I guess this is also one of the reasons we are here. But the other thing I want to show you is that GBIF provides a lot of nice tools for like network setups like WAASuN. So if you decide at some point to start publishing your data and you would like to have it as a network, are options like the freshwater network, for example. So this is for all the people that publish freshwater data. And what they did is to set up this page. They have a description here, and they even have a guide that has been recently published on how to, publish specific freshwater data. But they got a list of publishers, so we can see all the institutions from those who published freshwater data. And all the data sets are here. They got around 800,000 records in 993 citations. And there are some other metrics. Again, these are the freshwater distribution of the data. But what is interesting of this setup is that it gives visibility at many different levels. So you have visibility for the network, you have visibility for the publishers, for the data sets, and then you have aggregated metrics for the whole thing. And one other option is the hosted portal. What I'm going to show you now is not live yet, but it's because it's a vector example, I think I can show you, and a lot of people have seen it now. So I guess at least some of you know VectorNet, the European network. And they not recently, but they've been talking to GBIF about having a hosted portal, which is a bit more sophisticated than the network page. So what they wanted is that everyone that is part of network or is funded by EFSA or the ECDC or other European agency to put their data in this portal in GBIF. No, they have to publish in GBIF, and then this portal pulls the data into the portal. And the thing is, because at Europe, they are at very advanced stages of requiring open data. They have very strong policies to make data open at all levels. So one nice feature of the data portal is that if you go to this thing, you will have different displays. So you can see, again, a map with all the data from their publishers. And again, and you can click on a dot, it will give you the record. It's because I need to zoom in a bit, maybe. So you can have very detailed information on each specimen they collected. And what else? You can have a gallery with images, which they don't have yet. The list of data sets, so they have so far, because this is still on preparation stage, it's not ready, but we have data sets from many countries already. And there is a dashboard which you can customize. Where is the dashboard? It's because I had the map thing on. Let me. It's just showing me the map for some reason. And then you can download. It will tell me that I need to have an account. So again, this is one nice thing that protects the data, because if you want to download data from GBIF, you need to create an account. So this creates kind of a chain of, so you know what's happening. And recently, there's been the discussion on the pandemic agreement. And one of the big issues was called the PABs, access and benefit share mechanism. And this was very agree, because a lot of countries have a bad experience of providing data, and others using the data to do things that, in the end, we have to pay for something that we provided the information in the first place. So the PABs they are trying to set up in a way that protects everyone. And GBIF has been mentioned as a good example of how to protect the data and create this kind of provenance, to create a lot of information on all the data kind of life cycle. So if people use that information, you can easily track to who actually created or provided the data in the first place. So these are just some features. I would like to say this is another hosted portal. This one is published. So there are lots of nice features you can put. And I guess that's it. I invite you all to have a look at the portal and search the tools. And Tiki and I are here until tomorrow, so feel free to reach out to us. And thank you.
Thank you so much. I don't know if you have any question. And as she said, I think Tiki and I and she are still around. I like the pictures on the link, so very bright. Maybe we link Andy with the photographer here. Okay, I think Prof have one question. Question or comment?
Thank you for the presentation on global biodiversity information. My attention was particularly drawn to your mention of open access data open access data. And I'm afraid that this may conflict with some national or local laws and regulations in some of the countries. Like Nigeria has the National Data Protection Act of 2023, an act of parliament, which means that the country focuses a lot on protection of the data coming from various facilities and faculties. So I'm wondering, therefore, how we may want to place the open data policy that you mentioned here with such countries like Nigeria that I mentioned. Thank you.
Thank you. Thank you for your question. It's a very important one. But usually these national laws, a lot of them, they are concerning private citizens, so really private data. They're not necessarily, their scope doesn't cover research data. Otherwise, we wouldn't be able to publish our data in journals, right? So, and again, this is another delicate issue because when we talk about publishing data in journals, some of the journals, we actually give the publisher our data. We give them the copyrights. And to me, this is much worse than having my data on an open repository that it says is mine, that everyone knows it's mine. I mean, it's not even mine. It's from my government who paid for me to do the research, but you know what I mean. So it depends a lot. So the European Union has also a lot of what they call the GDPR, some acronym, sorry, I don't remember, law, but this usually for personal kind of protection, yes, protection of the individual citizen. So I'm not sure how it works in Nigeria, but then we would have to check. But usually they do not cover research data. So, because if they do cover research data, I think it would be difficult for the people in Nigeria to publish papers, really. So, not sure it helps very much, though.
Anyway, thank you. Yeah, oh. I was going to close now. Your hands raised. Does it mean that it's late now?
Yes, thank you very much for your presentation. I would like to ask this question. Any data that is downloaded from GBF is accepted by all journals, or is there any, because some journals ask for, ask the authors if they got some permission before getting these data?
Yes, I'm not sure about all journals because I don't know, but most journals and experience because I'm a medical entomologist and I've a few papers, my experience with most medical entomology journals is that they are actually more than happy to have your data in an open repository. So we discussed in the training the example of parasites and vectors. I guess you all know parasites and vectors. And it's now from Springer. And in Springer, if you really go around their website, you will find they actually say if you have data on organisms, you should publish in GBIF. It's very well hidden, so we spoke to some people at Springer, and they decided in the next guide to authors from parasites and vectors, they're going to be more explicit in the parasites and vectors manual. But most journals, they are happy. So one thing we discussed is that you can publish your data in GBIF, but if you're waiting for your paper to be accepted, and one nice thing, which is what we advise as best practice, is to publish your data set in GBIF, get the DOI, and put in your paper. So you have your DOI from the data set linked inside the paper. But if you want to have your data set public only after your paper, you can put an embargo like you do in CBI, for genetic sequence. You can ask GBIF to release, I don't know, a year from now, but you will have the DOI in your paper. So it's, from our experience, yes, most journals and editors, they actually welcome the data to be in an open repository. And again, I'll give you the example of supplementary material. Because if you go to supplementary material, sometimes are the stuff there. no, the link doesn't work anymore. So supplementary material for me is like one of the worst, most frustrating things that ever existed because I never find what I want. But if you have something that it's, there in GBIF will be there as long as the network exists, but the strength of a network, and it's nice that we are at WAASuN because the strength of a network is exactly this. No, you got a lot of people working in a very kind of decentralized way, and it makes it stronger actually. So unless GBIF kind of goes, the data will be there.
Okay, yeah. I would like only you explain how WAASuN can enter like a node in the GBIF. We have this explanation. The rest of the people not. So could be good.
Sorry, did you say? Yes, I think like one of the kind of the easiest solution for now would be to have a network page. But then GBIF would only set up a network page if you already have a few data sets there. So that would be needed like at least 5 or 6 data sets, and we can talk to GBIF and say, well, we would like the WAASuN network page. And then at some point, if you decided to go, for example, for the hosted portal like VectorNet did, they will help you set up the portal, which is basically a website. And they will give you all this, so you don't have to worry because they will host, they will provide a lot of IT support, which is for free. So I guess I'm not sure about having WAASuN as a publisher. I guess we would need to talk, but I'm not sure it's really worth having WAASuN as a publisher, but maybe as a network, because it also gives a lot of visibility. So then you would be exposing WAASuN not only to our colleagues, but to a much wider public. And that might be interesting in terms of getting collaborations, getting more kind of funders. And I think one of I guess I'll just finish by saying this, because Bill and Melinda Gates was mentioned, a lot of funders, they put a strong emphasis on, sometimes if you can show you are already making data open, increase your chances of funding. Because especially in our experience, Bill and Melinda Gates, they are really it's something they really value. So if you show, we already have some data open, we plan to do that, it increases a lot the chance of funding. So I guess that's it. Thank you.